You're welcome. Hello. Yeah, sure. Because I know you guys are writing exam tomorrow. Somebody told me that you guys are writing exam tomorrow, so I feel tomorrow morning. So for you, that means you need to sleep very well. So for today, we are just going to focus on these two. We'll focus on these two chapters since we've already done endocrinology. Mm, that's okay. Hmm. A lot of people in the lab. Yeah, I wanted to wait for them, but I think we will be, discussing one or two things before they come, before they join us. I want to wait till once we get up to 20, at least 20 people, then we can start. For now, we are just 10. Mhm. And today we will not be, I won't spend time discussing these chapters because I believe that all of you must have read it. So I'll just go some. But I need us to get to 20 people. So I'll give extra 5 minutes to make sure we get to 20 people. All right. Is there something anybody wants me to explain with this time we have on male reproductive cycle? Hello. So somebody sent me an email and was trying asking me about meiosis one and meiosis one and meiosis two. So I'll describe them, and when we get at least 20 people, we can start the questions. All right. So for meiosis one, as I discussed initially, um, it just follows the normal pattern. All right. We have prophase P. I pass my anatomy test, right? Interphase. After interphase, and then it starts with prophase passed, metaphase my, anaphase anatomy, telophase test. So pass my anatomy test. That's the formula. All right. So you know the sequence in case of if they ask you the sequence. All right. So we have early prophase and mid to late prophase usually. But one thing you need to know about prophase is that prophase is about arrangements, everything being organized. All right. And know that crossing over happens in the prophase. Okay, we are 14 now. Let's get to 20 for us to start. I want you to remember that crossing over happens at mid to late prophase. Usually they are not very specific, but know that crossing over happens at what? Prophase stage. All right. Aha. Then we have metaphase. Metaphase is where they align at the equator. M for M, that's middle. Then we have anaphase. Anaphase is when they separate. All right. Homologous chromosomes separate and migrate to the opposite poles of the cell. Then after that, we have what? Telophase. Telophase is when the cell breaks into two. That's cleavage. Very important that you understand this. So when this thing has happened, so one of the major differences between male and female reproductive cycle is female reproductive cycle also follows this pattern. All right. Now look at male reproductive cycle. It produces two. You see, these are the two daughter cells that it produces. But for female, okay, now if you look at it, this male two daughter cells will start meiosis two and undergo the same process as meiosis one. They'll start meiosis two down. So at the end of the day, this one guy here broke into what? 1, 2, 3, 4. That's the beautiful thing about the male the sperm production. All right. Now, if it is egg production for female, it undergoes this pathway. Then when it comes to this particular part, right, instead of it divided into two, it will actually divide into two, give rise to these two, but one will degenerate. This one that degenerates, we call it what? Polar one. Polar body one. I know I'll be lagging. I lag because my laptop is hanging. So, but just bear with me. So it will become polar body one. All right. Polar body one. Yes, crossing over happens, but as far as it's prophase, it happens. All right. So whether one or two. The same thing that happens in one happens in two. That's just the thing. So, but the only thing is that it has to give rise to 4. Now, this is for female. This one here degenerates, become atretic. You understand? So we call it polar body 1. Then this guy here will start breaking down again into another 2. When it breaks down into another 2, that second one will degenerate again. That is polar body 2. So for female, we have polar body 1, polar body 2. But for male, it does not break down. All right? It does not break down. So at the end of the day, it will still give rise to this 4. So female is supposed to be 4, but 1 become atretic. So you guys need to understand the difference between the male and female reproductive system in terms of this pattern. All right? So that is meiosis. When you are talking about mitosis, mitosis still follows these stages PMT, PMAT, rather. Right? Pass my anatomy test. It still follows this pattern. But the difference between mitosis and meiosis is that meiosis is sex cell. Mitosis is body cell. All right? Meiosis is what? Sex cell. Mitosis is what? Body cell. If I cut myself now, it will heal mitosis. But for my sperm to produce, it will produce with what? Meiosis. That's just the thing. So if you understand it, you are good to go. All right? So every other thing. Now, this is the pathway. I'll show you the pathway for male. I will show you the pathway for female. You understand? So that you guys will understand it as we're waiting for these people to make to finish what they're doing and join the class. So you see, for male, you have to also know the sequence in terms of name, right? So this is the type A spermatogonium. This is the tight junctions. It becomes what? Type B spermatogonium. This type B spermatogonium is what undergoes what? Meiosis 1. All right? So type A spermatogonium becomes type is the one that remains in the basement, right? But it gives off another type, which is type 2. Or type B rather. So this type B is the one that continues. But this type A remains in the basement membrane. It does not continue to break down, or it does not go into meiosis. So when they ask you which one goes into meiosis, it is type B spermatogonium. So this type B spermatogonium, it comes to this place. After meiosis 1, it breaks into 2. Breaking into 2, we call it what? Secondary spermatocyte. This type B spermatogonium becomes what? Primary spermatocyte. So primary spermatocyte is what enters meiosis 1. After meiosis 1, it becomes secondary spermatocyte. These 2. All right. Now this secondary spermatocyte will enter meiosis 2. After meiosis 2, it will become 4. This 4 is called what? Spermatid. Then this spermatid now matures and become what? Sperm. So the process whereby spermatid becomes sperm, spermatid to sperm, is known as what? Spermiogenesis. But the process whereby type B spermatogonium enters meiosis 1, enters meiosis 2, and become what? Mature sperm. That's everything here is known as what? Spermatogenesis. Spermatogenesis. But from this spermatid to mature is what? Spermiogenesis. So they may ask you a question on to differentiate between spermiogenesis and spermatogenesis. Everything is spermatogenesis, but just from spermatid to spermiogenesis is from spermatid to mature is known as what? Spermiogenesis. Check it out. I believe everybody understands this. Now, if you look at the female version of what we just discussed, let me show you the female version. This will benefit people that are here. Once we get a proper number, we jump into the questions. I'm not teaching anything, just jump into the questions. So I need you to stick with me, all right? Now look at for female oogenesis. This is from this particular place to primary oocytes, all right? It becomes at primary oocyte, just like primary spermatocytes, meiosis 1 starts, all right? This meiosis 1, oh, now this primary oocyte is unchanged. This meiosis 1, so meiosis 1 is complete. When meiosis 1 is complete, it gives rise to 2 ovaries. This is one of it. Then this is the tiny one beside it. That's 2. So this tiny one, because beside it degenerates, we call it what? Polar body 1, first polar body. Now this remaining secondary oocyte, just like the spermatocyte, enters meiosis 2. It continues in meiosis 2. Now after meiosis 2, all right, look at it. After meiosis 2, meiosis 2 gives rise to what? Another one, right? That's 2, 1, 2. This one degenerates and become what? Second polar body, remaining only 1. And another thing you need to know is that this meiosis 2 gets into completion when sperm, laps with this particular oocyte. All right. So this meiosis 2 gets into completion. They may ask you, where is this thing arrested? It's arrested in metaphase 2. So at that metaphase 2 is arrested, everything stops. All right. So when sperm just touches the egg, it becomes what? It completes this meiosis 2 and becomes what? The zygote or embryo. So without the sperm, it can never complete meiosis 2. That's what you need to understand. Yes. Meiosis is sex cell. Mitosis is body cell. Yes. Okay. So that's what I wanted to show you guys. All right. That's the comparison. Another thing I want to compare is the sexual response, because this is another place that they will use to catch you. All right. For the benefit of the people that are here. This is the sexual response. So men and women, they work in 2 different ways. All right. Which you need to understand. There are a lot of similarities, but a lot of differences as well. So look at the neural control of male sexual response. Men work a lot with their eyes. All right. So when a guy sees something, he creates a mental picture of it. Oh, this person looks good. He creates a mental picture of it. Immediately he creates a mental picture of it. That information is carried to where? The spinal cord. All right. The gray matter of the spinal cord. Immediately that information is carried there through the afferent nerves. Then it's now taken out of the spinal cord. It's interpreted in that gray matter and taken to the penis. All right. Look at it here. Look at the information through the what? Efferent parasympathetic what? Signals. You understand? The pelvic nerve will carry it straight out. And once the pelvic nerve carries it out to the penis, what does it do? The deep artery of the penis dilates. All right. Erectile tissues engorge with blood, because dilation, it opens up, so a lot of blood will jump inside it. That's when the penis starts rising. You see my head? Penis starts rising. All right. Now, the erectile tissues engorges with blood. Penis what? Becomes very erect. This is the penis. Very, very erect, pointing. Then as it's erect, this pelvic nerve will still cause something we call the trabecular muscles of the erectile tissue to relax. This relaxation leads to more engorgement of blood. Blood will still keep jumping inside. All right. Then after that, as it's going on, the bulbourethral gland will secrete what? Bulbourethral fluid. That is the phase of excitement for male. Phase of excitement for male. If you compare this phase of excitement for male with phase of excitement for female, let's see. Have I passed it? Yes. Okay, look at for female. You see, for female, usually this is how the uterus is. The uterus is bent, tilted forward over the urinary bladder. Everything is relaxed. Labia minora is retracted. Everything is relaxed. But immediately that woman is stimulated, usually by stimulation. All right. This is the phase of excitement. This is what happens. The uterus stands more superiorly. This is the uterus normally. You see, she's still lying down here. The same thing, the same lying down. This is the uterus bent forward over the urinary bladder. But here, the uterus is what? Standing erect. You see? That's one of the things they test you on. What happens for excitement in female? For excitement in male, it is usually the penis that gets erected. Excitement in female, it is usually the uterus that's what gets erected. All right. And when it immediately gets erected, what happens? This vagina here, the vagina here, look at the arrow here, the vagina will become what? Dilated. It will open up. It will become what? Dilated. For male, the artery will become what? Dilated, and blood will engorge. The trabeculae will open up, and a lot of blood will still fill the trabeculae to maintain that erection. But for this person here, this thing just erects, goes superiorly. All right. Now the labial minora becomes what? Vasocongested. A lot of blood will fill it in. All right. And sometimes the labia majora and the labia minora and the vaginal mucosa become red just because of that congestion. Oh, are we back to 15? Please, we are there now. They should hurry up. All right. Everything becomes what? Red because of what? Hyperperfusion. Hyperperfusion. A lot of blood engorging in it. So the same thing that causes erection in the male is what causes erection in female. Blood jumping inside. All right. Now everything becomes red. That's what we call what? Hyperemia. Now, unlike the male, the female, rather, unlike the male, the female vagina starts sweating. It has no gland. So because that vagina has no gland, it will start sweating. That sweating is called, we call what? Transudate. That sweating is what we make the vagina moistured, lubricate the vagina. For the male, it is what? It is the bulbourethral gland that secretes, look at it. Bulbourethral gland secretes what? Bulbourethral what? Fluid. So for the male, once they start seeing something, all right, what happens? There become fluid, coming out at the mouth of the penis. Now, for the male, from the excitement phase, they enter what? The orgasm phase or the emission stage. At this stage, the spinal cord is still in charge. This time around, it is no longer the efferent parasympathetic. This time around, it is what? The efferent what? Sympathetic. It is the efferent sympathetic that causes orgasm in male. They may ask you this question. Efferent sympathetic causes orgasm, but efferent parasympathetic causes what? Excitement. You are just relaxed, parasympathetic, and relaxed and excited. But for the orgasm, what is happening? At that time, you see the guy going in and out, going in and out. So that's going in and out. The person is no longer relaxed. So naturally, it becomes what? It becomes sympathetic. Sympathetic is action. Something is happening. Action. That is sympathetic. All right. So that is during the orgasm phase. That's emission stage. This is the emission phase. At this emission stage, the sperm is already coming out, but the sperm has not started coming out from what? The mouth, the mouth of the penis. All right, the sperm has not started coming out. So it is called what? Emission stage. At this moment, sperm is moving into the urethra, but not out of the urethra yet. Into it. You have to remember this. Now, at this level, another fluid comes into play, not the bulbourethra. Remember, the bulbourethra is for excitement. The parasympathetic signal is for the excitement. But for the orgasm phase, that's the emission stage, this time around, what is in charge of the fluid is what? The prostate. The prostate will secrete its what? Seminal fluid. Also, the seminal vesicle will also secrete what? Seminal fluid. So if they ask you for the orgasm phase, it is both the prostate and what? The seminal vesicle that produces the fluid. I hope you understand that. So that's for orgasm phase 1 for male. Orgasm phase. So male have 2 orgasm phase. When the sperm enters inside the urethra, that's emission stage. Now the orgasm phase 2 is expulsion stage. Expulsion stage. This time around, the efferent signals enters the spinal cord and the efferent brings it out. Now this efferent, you understand, is still sympathetic. Mind you, sympathetic nerves, all right? Because the guy is still going in and out, everything is quaking. That's sympathetic action. At this moment, the prostate still releases additional secretion. Seminal vesicle still adds additional secretion. Then the internal urethral sphincter contracts. That's contraction. You see the guy jacking, shaking, all right? That contraction is as a result of the sphincter. It contracts, all right? Immediately it contracts, it stops the urine from coming. So that's why you will not see urine mixing with sperm. Remember, that urethra is known as what? Urinogenital organ, because urine passes out from it and sperm passes out of it. That's urinogenital. All right? I'm taking time to explain this thing so that I will not lag. All right? So that's what happens at orgasm phase 2. Then there's rhythmic compression of the bulb. The bulbocavernosus muscle contracts. Remember this bulbocavernosus muscle for expulsion. It contracts the root of the penis, and immediately sperm is what? Ejaculated out. That is for male. Orgasm phase 1, orgasm phase 2. Orgasm phase 1 is emission, orgasm phase 2 is expulsion. Same sympathetic. All right? Prostate, seminal vesicles. Very, very important. Okay. We have one more person to go. Now, for the female, we already discussed the excitement phase. All right. They have the plateau phase before even their orgasm phase. In this plateau phase, the uterus is what? Still erect. The cervix, you see this cervix, this is the cervix, we go up. It will go up. Why is it going up? It's going up to allow this penis to keep going in and in and in. All right. Keep going deeper and deeper. This is the penis as it's already incited, going back and forth. So now, for it to avoid to continuously hitting the mouth of the cervix withdraws itself and say, please, oh, I'm not involved in this action. The cervix goes up. All right. Now it withdraws from the vagina, giving the vagina more room. So the vagina becomes wider and longer at that moment, all right, to contain the size of the penis. Now, the vagina also constricts the penis. It holds it. You understand? It wraps around it and holds it, all right? At that moment, that's what we call, the clitoris is what's engorged. The glans is withdrawn beneath the prepuce. The labia are bright red or violet. This is the plateau phase. Okay, we are complete. So let me finish up this. This is the plateau phase. Now, the orgasm phase. Remember, for male, we have orgasm 1 and orgasm 2. And I told you what controls it. For orgasm phase here, all right, there is where orgasmic platform contracts rhythmically. There's contraction, contraction, contraction. All right. Now, the cervix may dip into pool of semen. Uterus exhibits what some will call peristaltic contraction. Now, for male, we say that the contraction is as a result of the what? The sphincter. But for this female, there is just for females, there's something we call peristaltic contraction, just like it happens in the digestive system. So just be coming like this, coming. You see the person quaking, all right? Also, the anal sphincter and the urinary sphincter constrict. So before the anal and the urinary sphincter comes into play, peristaltic contraction has been happening. So the person is shaking, all right, at that moment. So that is for orgasm. Now, going for the resolution for female, the resolution phase, everything goes back to unstimulated phase. But another thing you need to know is that person, the female can continue going. You understand? Enter another phase, enter another phase, enter another orgasm, another orgasm. So you see, a female can have orgasm a lot of time. Why? Because they don't have resolution phase. So if they ask you, why does a female don't they don't have they can have a lot of orgasms? Because they don't have resolution phase. All right? Refractory phase, rather. Not resolution, refractory phase. Unlike the men, this is their resolution. Everything goes back to normal. But the problem with their resolution for men is that they enter something we call refractory phase. And that refractory phase, there's nothing you do to that penis that it will rise. But female, they don't have what? Refractory phase. That's what we discussed. So if you look at it, this is the refractory period following resolution, in which it is usually impossible for a male to attain another word, erection or orgasm. Sometimes it lasts for 10 minutes. So what you do is don't stress that person, or don't stress, just relax, calm down, drink cold water. It will rise again. All right. Okay. So that's, I want to also tell you that what you'll be tested on is also this drug. They will give you this drug. Okay, we're up to 20. They'll give you this drug, sildenafil, all right, and other medications. Like we call them like Viagra, Levitra, and Cialis. They're all of them. They're called what? Phosphodiesterase inhibitors. All right. What they normally, the sexual stimulation triggers nitric oxide. There's something called nitric oxide. This nitric oxide activates CGMP, which increases blood flow into the erectile tissue. All right. CGMP increases blood flow into the erectile tissue. So if CGMP increases blood flow, right, making the guy to be erect, what will cause the penis to fall? The penis will fall when this CGMP degrades or breaks down. So if I want somebody to maintain erection, what do? I just give the person a phosphodiesterase inhibitor, all right? And what will it do? It will inhibit this CGMP, cyclic GMP, to inhibit it from what? Breaking down. So the person will continue maintaining erection. So that's exactly the diagram here. You see, normally this sexual stimulation, immediately somebody is stimulated, nitric oxide is produced. It activates inactive guanylate cyclase to active guanylate cyclase. This active guanylate cyclase will convert GTP towards CGMP. This is what we are talking about. This CGMP is what will cause vasodilation and a lot of blood and jumping into the penis, leading to erection. All right. Now, CGMP is broken down by phosphodiesterase. It's degraded by phosphodiesterase 5. All right. And immediately it's broken down, you lose erection. So what do? We give medication, phosphodiesterase inhibitors, to inhibit this CGMP from breaking down. All right. So that will make me ask you the first question I want to ask for today. I think we're up to 20. Oh, just to verify. Okay, I've answered this question already. So let me ask you the first question, testing the microphone. Since we are, we've spent, this is 8:30. Okay, so I've given these people up to 30 minutes. I believe that they should be rounding up right now. So let me give you the first question. Now, the rules and regulation. I'm always saying the rules and regulation. So that it's not like, why is this thing too close to me? This my camera is funny. I don't even know how to control it. Okay, please, anytime I'm lagging, just try to tell me, all right? So the rules and regulation is that at least 10 to 15 people must respond. If you don't know the answer, listen, you guys have exam tomorrow, so I need you to be very engaged and active. If you're up to 20 people here, 20 people should be commenting. Don't fold your hand and start looking. If you, oh, I know it. When you respond to a question, it will help you to remember, all right? Because there's a lot of questions. So when you respond to it, and I'm not taking this revision. No. Oh, it's not lagging. No, the laptop is not here yet, though. The laptop is not here yet. So I even asked a friend to give me a laptop. They are customizing it. There are some features I put in the laptop, so they need to customize it for me. So there's, according to them, they say it will take probably till 10th of this month or 15th. I think between 10 and 15th. So still using my laptop. Oh, it's better today. Okay. I think it's better today because I had to remove everything I have, virtually everything I have on my screen. It restarted my laptop. You understand? So that before this particular project. Okay. So the rules and regulation, please, I'm begging all of you. I need you to respond. When I see a lot of people answering questions, get it wrong. It's okay. Even if you get it wrong, no problem. If everybody's answering the question, answer yours. Answer yours because the exam is just you. I want you to be able to remember. All right. Yeah, you are ready. The others may not. And if you are not able to type, because some people are complaining to me that they are not able to type, you need to log into your YouTube and into my channel. And if you are not following, try to follow this channel and try to give it a thumbs up. All right. So I'm going to start with the first question. Please, if you don't have the know the answer, write no idea. If I give the options, attempt it. All right. Put the answers in the chat. No, the problem is that, okay, well, I can, but it will slow me down because most times I have to copy it one after the other to put it in the chat. But I will do, as you say, anything you say, I'll try. All right. So this is the first question. Now, some answers, I will not post it. Some answers, I will just say it out, and I need you to pay attention. All right? Still send message if you to your groups. Tell them that I'm waiting for them, that they should, hurry up and join the session. Okay. So let's start because I really want us to spend just 2 hours, at most 2 hours, 30 minutes. Okay. So this is the first question. This is the first question. Sildenafil prolongs. It's easier to save the questions. Oh, okay. Sildenafil prolongs erection by what? Let me give you the answers. This is A. This is B. And another thing I need to encourage you is please look at the equations very, very well, then attempt it. All right? Extra, it's always good to, because some people actually fail questions because they don't look at it. Not that they don't know it. Some questions will tell you not, and you not know that it is not. You just answer, all right, and you get it wrong, and you become pissed off after the exam. So look at this question. Sildenafil, that's Viagra, prolongs erection by dash. A, activating nitric oxide production. B, inactivating guanylate cyclase. C, stimulating production of CGMP. D, inhibiting the degradation of CGMP. E, inhibiting nitric oxide production. Okay. Yeah. Okay, good. I'm getting a good number of response. So yes, you guys are very correct. The answer is D. Sildenafil prolongs erection by inhibiting degradation of CGMP. I just discussed it some minutes ago. You see how the question comes? Everything is important. Everything is important. All right. Yes, yes. Keep clicking this. Everything is important. Look at this question, guys. I'll need you to look at the question, then I will read out the option. I'll read out the option. All right. The question says heart rate, blood pressure, and respiratory rate peak during dash. Heart rate, blood pressure, and respiratory rate peak during dash. A, excitement phase. B, erection of the penis. C, climax, in brackets, orgasm. D, plateau phase. E, resolution phase. Mhm. Trying to allow this laptop to capture my hand. It's always moving. Mhm. No. Mhm. Exactly. This is how it should be. Okay. Lagged for me. Oh, I'm sorry. I'm sorry. So let's see. What's everybody say? I should repeat. Heart rate, blood pressure, and respiratory rate peak during dash. A, excitement phase. B, erection of the penis. C, climax bracket orgasm. D, plateau phase. E, resolution phase. What's your answer? Let me see. No. This option is just one option. There are some options I will put when it's long. This one is just one option. A, excitement phase. B, erection of the penis. C, climax or orgasm. D, plateau phase. E, resolution phase. So you need to pay attention so that it will be faster. There are some that I will not need to post, all right? Like something like this one. Let me see. Orgasm. Yes, please. The answer is orgasm phase. At orgasm, I don't know. For people that are having sex, orgasm, you see the heart rate will increase, blood pressure increase, respiratory rate will what increase. This peak. You understand? Aha. Even the facial expression self is always different. I'm crazy, I know. I know that's what you're saying right now, but it's okay. So all of you are correct. The answer is C, all right? Very important that you know this. You see, this exactly why I was telling you that this kind of questions is what it says. Look at this question, guys. Take your time to look at it. I'll give you options. Take your time to look at this question. I'll give you options. This is A. This is B. This is C. This is D. This is E. So The orgasm emission phase of the male sexual response is stimulated by dash. The orgasm emission. Remember, we have two parts of the male orgasms, right? The orgasm emission. That's why I was telling you guys, you need to focus. That's why I reviewed it before we started. The orgasm emission phase of this male sexual response is stimulated by dash. A. Efferent sympathetic signals from the sacral region of the spinal cord. B. Efferent sympathetic signals from the lumbar region of the spinal cord. C. Efferent parasympathetic signals from the sacral region of the spinal cord. D. Efferent parasympathetic signals from the lumbar region of the spinal cord. E. Efferent somatic signals from the thoracic region of the spinal cord. No, you don't need to be nervous. You just need to understand it and think about it. Just need to understand it and think about it, all right? So you guys should keep answering, please. Everybody answering. So keep answering before we go to look at it. Very important. Are we done? Let me see how many people. Okay, at least more than 10 people responded. Okay, so this is the what our they are asking us. They are asking us about the orgasm emission phase. This is this phase, right? This phase, and this is the efferent sympathetic signal. All right. So I believe everybody understands that this is efferent sympathetic. So the problem is it from sacral or is it from the lumbar? Please, guys, the efferent sympathetic signals, it's not from the sacral, it is from the lumbar. Thank God. You see, that's the beautiful thing about doing questions. It's good that I clear it. You see, we are 31 people here. The remaining 80 people, 50 people that are not here, we see this question or something similar to this question, and they will pick sacral region, because looking at this option, majority of you picked A. You understand? Majority of you picked A. You say sacral, exactly. So that you see, it says sacral nerves are parasympathetic and not sympathetic, which makes sense. All right. So that's why A is wrong, because A is talking about sacral region and sympathetic. Do you understand? So it should be sacral region. It should be lumbar region and sympathetic. That's why B is the answer, not A. Who is confused? Anybody confused? I hope you attempted this question, guys, and I hope you attempted it. Even as you got it wrong, remember. Beautiful. As you got it wrong, if you see something close to this in exam, you should remember. This is how they ask. You know, initially I was talking about the sexual stuff. Some people are busy enjoying it and smiling and enjoying it. I'm not telling you for you to enjoy it. I'm telling you for you to catch the little details. And these are the little details. Okay. So that makes sense. I love that question. So I'm going to remove this now because it may lag more. Good. So look at this question, guys. So that's why you have to go back and watch that video I taught of the class yesterday. Look at this question. Dilatation of the dash causes the cavernous spaces to fill with blood and the penis to become erect. They are just asking you which artery is involved in erection of the penis. Options. Pay attention for the options, guys. Or let me just post it in the group so that you know. Is A. This is B. This is C. This is D. This is E. What's the answer, guys? Dilatation of the dash causes the cavernous spaces to fill with blood and the penis to become erect. A. Helicin arteries. B. Internal pudendal bracket penile arteries. C. Dorsal arteries. D. Dorsal veins. And E. Deep arteries. Let's see. Where is everybody? Where is everybody? I'm going to take your educational guess. If it's not, I no. You should always be make sure you always respond. All right, it's very, very important. Okay. Okay. Yeah. So A, helicin arteries. B, internal pudendal arteries. C, dorsal arteries. D, dorsal veins. Guys, I see a lot of people picking D. So please, you cannot pick vein. Vein takes blood away, not to. Always remember that. Most of you are picking D. Veins take blood away, not to. D is dorsal vein, right? Takes blood away. Here they're asking you what fills the blood in the penis. It must be an artery. All right. It must be an artery. And the answer is E, deep arteries. The answer is E. E for elephants. Deep arteries. All right. Not dorsal veins. Deep arteries, not dorsal veins. Okay. I just love my No, you shouldn't. It's nice that you attempted it and got it wrong on the review than to get it wrong on the exam. You see why I had to bring out time for this review? Because I really want you guys to be seasoned in this. This is not just for your exam that you're writing tomorrow or so, but to know it, permanently. To know what controls what. When you get to the clinic, when you see somebody having an erection, you know what is causing it. You understand? Some people can have sustained erection. The penis will refuse to fall for hours. What do? You irrigate. How do you know what to irrigate? How do you know what to irrigate? It is by understanding the anatomical and the physiological arrangements. All right? So that's the point, to know what is controlling what. You understand? And like when you are doing things, when you're married and you're having sex, or something like that, you know what you are doing. You know what is controlling what you are doing. Okay, let me ask you this question. Based on what I just said now, look at this question, guys. Which of the following explains the neural mechanism of an erection? Which of the following explains the neural mechanism of an erection? So you can hold your pen, put it in your mouth for now. Let me put in the options. So that's A. Let me put in B, incoming. This is B. There are some people that are not responding. I need everybody to attempt it. If you don't know it, write not sure. But truly, it's better that you attempt it and get it wrong without following others. Put something you think is right in your head that you choose if you meet this kind of question in the exam hall without this review. That's what I want you to do. Put that answer. All right? Without this review. You don't need to start looking at your slide. I know some people are looking at the slide now, checking it, going back to check it. You don't need to do those things. I need you to attempt it as if, because you've already studied. All right? You've already had the lecture, you've studied. So I need you to attempt it as if, oh, this is your exam, assuming. So let's go. Let's go, guys. Which of the following explains the neural mechanism of an erection? So I know it's parasympathetic, not sympathetic, but I'm not sure whether it's autonomic or somatic. Okay. Which of the following explains the neural mechanism of an erection? It is an autonomic reflex mediated predominantly by parasympathetic nerve fibers. It is an autonomic reflex mediated predominantly by sympathetic nerve fibers. It is a somatic reflex mediated predominantly by parasympathetic nerve fibers. It is a somatic reflex mediated predominantly by sympathetic nerve fibers. It is exclusively voluntary action mediated by the cerebral cortex. Let's go, guys. Let's go. Pour it in. I'm not lagging too much. Let's go, guys. Are we done? Only 7 people. Come on now. We are more than this. Okay. Yeah, let me start with I have a feeling that this is A. Sorry, I'm late. I'm still in the lab. Yeah, it's okay. It's okay. Take your time. You guys are doing lab for 3 hours? Wow. Interesting. Interesting. 3 hours lab. Oh Lord. Okay. So let's look at this question. Question following explains the neural mechanism of an erection. Anything sympathetic, somebody was like, I know it's parasympathetic, not sympathetic, but I'm not sure whether it's autonomic or somatic. Anytime you hear sympathetic and parasympathetic, it's always what? Autonomic. All right? It's always what? Autonomic. It's always autonomic. It's an automatic response. Have you forgotten when we discussed in the nervous system, where did you see sympathetic and parasympathetic? Remember, we said sensory goes up, motor comes down. Now we say motor goes to, there's motor somatic, the one that goes to the body, to the skeletal muscle. Then we have motor viscera. Now that motor viscera we divided into two. Motor viscera is divided into sympathetic and what? Parasympathetic. Both of them are autonomic. You don't control them because motor viscera goes to the heart or to the smooth muscles. You don't control it. You're gonna be in the lab till 9:30. Interesting. The Lord is your shepherd. So that means even if I started 9 o'clock, you guys would have still not been in the lab. Interesting. Lab should be very quick. Yeah. So that's the point. So that rules out the 2 somatics we have. That's C and D. All right. Now let's talk about A and B. E is even out of the equation. Which one is cerebral cortex? E is even out of the equation. Look at A and B. That's what our problem should be. Now, A says it's an autonomic reflex mediated predominantly by parasympathetic nerve fibers. It's an autonomic reflex mediated predominantly by sympathetic. No, sympathetic is the one that's when you want to give out. That's the orgasm phase when it's now going out like this. All right. Don't laugh. I don't know why you're laughing. Now, I play too much. Now, the parasympathetic is the one that handles what? Erection. That they are asking you specifically about what? Erection. So if somebody is having an erectile problem, then you are thinking about solving that person's problem because through what is parasympathetic or nerve. And where is that parasympathetic nerve coming from? You remember what we discussed? Do you remember what we discussed in the prior question? What was that question again? What was that question? Okay, the question I asked about sacral and lumbar. All right, sacral and lumbar. But that one we are talking about what sympathetic, which comes from the lumbar. We'll still talk about it in terms of parasympathetic. But I need you guys to remember these things to be able to put it. Yes, sympathetic is mainly orgasm. Yes. Okay. So I hope you guys are catching it gradually. When somebody, okay, no, this question is pathology. Let's not go to that pathology. Yes. The answer is A. Yes. Let me see that question again. Let me be sure it's A. I don't use to. Yes, the answer is A. It's autonomic reflex mediated predominantly by parasympathetic nerve fiber. The answer is A. It's actually okay. Your 100 is on the way. Your 100 is on the way. Okay. So they may ask you about infertility. I'm not going to review the question here so that I'll be faster. When they ask you about infertility, when the sperm count is less than 20 to 25, all right, lower than 20 to 25 million per sperm per male, that is what we call what? Infertility. It's very sterile, like infertility. You cannot fertilize. 20 to 25, less than 20 to 25 million per kim, per ejaculation, kim, or per male. You understand? So when somebody ejaculates, if you check that ejaculate, 1 mil of it must be up to what? More than what? 25 million sperms. 20 to 25 million sperms. If it's less than, then that person is what? Infertile. All right. And also, infertility is usually when. Now, let me give you the concept of infertility. A patient came to the hospital. I don't know if I've told you this. They came to the hospital. They are talking about infertility. Oh, there are things you rule out for infertility, guys. Let me take this short moment to discuss it because I see questions on it and I don't want to talk about it. You may come out in your final exam. A patient came to the hospital. They are talking about infertility. First question you need to ask them: how many years are you guys married? 6 months, go home. It must be up to 1 year for infertility. They have to be married for 1 year, together for 1 year. Oh, are you guys living together? No, my wife is in Australia. I'm in the US. I visit every 6 months. It is not infertility. You must be together for 1 year. Okay, they say yes, we are together for 1 year. Okay, check. Then the next question I ask them: how often do you have sex? Say, how come? How come what? How often do you have sex? That's the next question you ask them. You have to check the box. Oh, you guys are together for 1 year in the same location, the same house for 1 year. Check. Then the second one: how often do you have sex? We have sex like once in a week. It is not infertility, even if they are together for 1 year. Oh, we have sex 3 times a week. Check. When do you people have sex? Oh, it's usually because my husband goes to work weekends or so we have sex like Monday, Tuesday, Wednesdays, 3 times, Monday, Tuesday, Wednesdays, but Thursday, Friday, Saturday, Sunday, we don't have sex. It is not infertility. Infertility, they should be having sex alternate days. So it's something like every other day, like Monday, Wednesday, Friday, or Saturday, something like that, at least 3 times a week. Alternate days. Oh, we have sex alternate days, 3 times a week. Check. Then you ask the question: do you have full erection when you are having sex? Do you have full erection? Is it standing? Give it back. You now say, no, it doesn't stand. Sometimes I carry it, this one, they carry it and they put it inside the vagina. No, it is not infertility because there's no adequate erection. So the woman look at the husband and smile and shake her head and say, yes, fully erect. Check. You feel me? Then you ask about ejaculation. Is the ejaculation adequate? Because we have adequate ejaculation. Some people, their ejaculation, one tiny something. It's not like that tiny something cannot fertilize, but that tiny something can be less than, you understand, 1 mil, or it can be less than 20 to 25 million. That's the problem. But if the ejaculation is adequate and the erection is adequate, so erection adequate, ejaculation adequate, sex every other day, 3 times a week, 1 year, and they are doing all these things and they don't have a child, that is infertility. That is infertility. That's when you start, okay, go do sperm counts, check the sperm of the guy, you check, because sometimes some people will be pouring out a lot of sperms, but the sperm has low quality. Low quality sperm leads to what? Infertility. Low quality in the sense that the sperms may be immotile, they may not be moving. So we do MCS for the sperm, microscopy. Sensitivity. You look at the sperm, you put in the microscope, look at it and check if it's actually moving. The sperm should be moving. You understand? All these very stubborn sperms, they should be moving up and down, running helter-skelter. But if you see all of them redundant, that means the guy is producing a lot of sperms, but not quality sperm. Let me tell you, there is something I was taught that, how do you know quality sperm sometimes? If your wife is pregnant and your wife is having a lot of vomiting and this, I was discussing it, but I told the person, well, that is one of the characteristics of what a quality sperm, not the major characteristics. So that the woman is vomiting a lot doesn't mean that the husband is the sperm is so quality. No, but it is one of the reasons. If the husband has a very high quality sperm, she'll be vomiting a lot, she'll be having a lot of, reaction. when she's pregnant. That's the truth. Go Google it. But the other things that can make a woman have hyperemesis, that's a lot of hyperemesis gravidarum. Like what? Like maybe twin pregnancy, like first time pregnancy, you know? So, but that's by the way. So, that's that about infertility. Now look at this question, guys. Look at this question. Look at this question, guys. The first option, this second option, please, everybody, we are up to 25 here. Everybody has to attempt. All right. As we are waiting for people that went to the lab, at least they can join us in the female rep. That's fine, because I'll be done with. So there are a lot of questions that I really need to, one of the reasons I'm pushing out a lot of questions is because I want you to, the more questions you do, the more prepared you'll be for your final exam. Because I may not have time to review this for a final exam again. So look at this question. Sperm cells get energy to power their movement from dash, which is contributed by the dash. A, prostaglandin prostate. B, sucrose bulbourethral gland. C, fructose semen of vesicles. D, seminogelin prostate. And E, semen seminiferous gland. You say I know the answer, but let me give everybody a chance. Okay. Somebody's challenging you guys, so let's see. Somebody's challenging you guys, man. Come on, guys. I thought this is testing the microphone kind of question. I honestly don't know. Okay, let me see. Yes, I like the fact that I need you, when you don't know, type it that you don't know. Your hand will remember that, oh, I never knew this question, and this was the answer I was told. All right? Okay. Fructose seminal vesicles. Sperm get the energy from. Okay. A, prostaglandin prostate. B, sucrose bulbourethral gland. D, fructose seminal vesicle. E, seminogelin prostate. D, semen seminiferous gland. Let me see. Yes, you guys are so correct. If you choose C, you are correct. The answer is fructose, not sucrose. All right, it's fructose, and it's contributed from the seminal vesicle. That's why seminal vesicle is very important. All right, that's why when fructose is very sweet. So when you test sperm, it is very sweet. That thing that makes it sweet, for most of you that have tested it, that thing that makes it sweet is what? The fructose. And it is given by the seminal vesicle. You see it's very transparent. You know what I'm talking about. I don't know why you're laughing. Okay. So I want you to see this question. I'm going to put the options. Look at the options here, guys. I need it once again. I am so smart. Yeah, so you are. You are. You're so funny. Hey, guys, look at this question, guys. Look at the options. Look at the options, guys. Which of the following is not a function of the nerve cells? They secrete inhibin, they secrete androgen binding protein, they secrete testosterone, they protect and support the germ cells. Their tight junctions form the blood testis barrier, which is not a function of the nut cells. Which is not a function of the nut cells. Come on, let's go, guys. Okay. So the answer is yes. You guys are so correct. The answer is C. All right. They secrete testosterone. They don't secrete testosterone. Which of the following is not? That's why they say it's not a function. Somebody that didn't see that not is busy saying, hey, looking for the answer. No. They secrete inhibin. Yes. They secrete androgen binding protein. Yes. They protect and support the germ cells. Yes. Their tight junctions form the blood testis barrier. Yes. Secretion of testosterone, it is done by what? Testis. There are cells in the testis that produces what? Testosterone. And those cells are called what? Leydig cells. All right? Leydig cells of the testis produces what? Testosterone. Okay. No. I've not confirmed that you guys are hot. I will tell you when I confirm it. I will tell you when I confirm it. All right? Okay. So without looking at your slide, give me the answer to this question. Then I'll confirm. I will not give option. Give me the answer to this question. Should you guys get it without looking at your slide? So answer it very fast so that I know that you're not looking at your slide. Secondary spermatocytes divide to form what? You see, you guys are not hot. If you are hot, somebody would have given me the answer by now. Let me give you option. That's okay. Let me give you the option. Somebody say, okay. Let's see. Somebody say spam. All of them are spams now. Spermatocytes, spermatogonia, all of them are spams. Let's see how hot everybody is. These people, maybe they are really hot. Is that is one professor or two? If you don't know if it's one or two, then there's a problem. If you don't know if it's one or two, then there's a problem. Honestly. Hey, God, let me show you. Don't worry. Because since I'm a little confused, I would just want to shed a little light on that diagram. Look at it here, guys. Look at it. Meiosis 1 is primary spermatocyte to secondary spermatocyte. That's meiosis 1. Meiosis 2 is secondary spermatocyte to spermatid. So the answer is actually spermatid. So you guys are very correct. Okay, I acknowledge you guys are hot. You are hot this night. Why is this thing coming close now? Like it's coming close. It makes my face big. I know. Acknowledge my hand. This thing is very stubborn. Please, let me continue what I'm doing. Whatever, any way you can see me, that's fine. So look at it. Secondary spermatocyte. So from primary spermatocyte to secondary spermatocyte is meiosis 1. From secondary spermatocyte to spermatid is meiosis 2. From spermatid to sperm, all right, that's mature sperm, is what? Spermiogenesis. From spermatid to mature sperm is what? Spermiogenesis. All right? I hope you guys remember this thing. Okay. I'm the sharing now. So you guys are so correct. Why? I say, why am I laughing? I'm always laughing now. It's just that this thing refuses to listen to me. Jesus Christ. I don't know the kind of camera this thing is. Okay, fine. So the answer to that question is spermatids, all right? I just explained it now using that stuff. I'm coming. Okay. Look at this question. Trying to centrifuge the question. Look at this. A, B, C, D, E. So the process of spermatogenesis and spermiogenesis begins with a dash and ends with 4 dash. And still like that, still like that, still like that, still like that, still like that. Still like that, no. Good. Yeah. He said, let me bring out my calculator. Good. Perfect. Finally. Hi, so leg. Oh, my dear, my leg is just there. I'm on braces. I'll be a brace. I don't know the pronunciation. But I'm just there, honestly. Like, I'm really just there. I'm really just there. I'm massaging it. I'm always with this. Okay, guys. So the process of spermatogenesis and spermiogenesis begins with a dash and ends with 4 dash. Sperm cell, interstitial cells, sperm cell, nut cells, secondary spermatocytes, spermatocytes in general, secondary spermatocytes, germ cells, germ cell, gametes. Thank you so much. You should stay at home tomorrow. No, no, I can't say. I can't. I wish I can. If I give an online exam, that means I'll give like 20 minutes for everybody to finish it. Finish on the 70 questions. Nah. Yeah, we can push to next week. Next week? Next week. Next week. Next week, Monday is what? Your final exam is on 19th because they sent me a memo. Is it 19th or 18th? One of those days. Next week is examination week now. You guys will know. Do you want to write exam? And for people that are in my class, you want to write it on Monday next week? Next week Monday should be 8. You want to write it next week? No, 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 I can't give it online. If it's about online, I can't give it online. No, I can't give online. But that's fine. If you, for people that are in my class, because I know there are a lot of students here, if nursing students have final on Monday, please push to another day this week. Monday. There are a lot of people in the lab. Okay, don't worry. Let's discuss this thing by the end of this class. That's why you have to stay put. By the end of the class, remind me, all right? Let's see. If you a lot of people, if I get up to 30 to 40 people here that says next week is better for them, because I really want to, for people that are in my session, I want to give everybody opportunity to do well, all right? And I don't want to rush you. So if you feel that next week is better, next week Monday is better, then I'll wait till next week Monday and I'll give it to you, all right? So you guys have to, if you have a group, I believe you guys have a group, put it in the class group, put it in your group now, and discuss it, so that by the end of this discourse, all of you, if I just ask that question, you give me a unanimous answer. And I'm expecting, by the end of this discussion, I'm expecting up to 50 people here. There have to be 50 people here. If we don't have up to 50 people, then I'm not going to take that vote. And if we have up to 50 people, if I can get at least 40 people, that's more than half of the class, then I will do it on Monday. Okay. The answer to that question is E. E is germ cell gametes. So the process of spermatogenesis and spermiogenesis begins with a germ cell and ends with 4 gametes. I don't know how to make a poll here. I really don't have the time. That's the point. Let me see. Do I know how to take a poll? Point chart, reaction, timestamp, moderation, participants. Hold on. Let me see. File form, then top charts. Hold on, let me see. Oh, I know how to take a poll. I've seen how to take poll. Okay. I've seen how to take a poll. Let your viewers weigh in. Okay. Okay, I've seen. Don't worry. We'll take a poll at the end of the class. Don't worry, relax. Relax. Let's not say. No, not now. I can't make the poll now because you're just 30. You're not even up to half of my session. And I know that there are a lot of students here that are not in my class. All right. So at the end of the class, we do a poll. Let's leave it that. So let's go back to what we are discussing. The process of spermatogenesis and spermiogenesis begins with a germ cell and ends with 4 gametes. When am I going to end the review? Well, I should have gone more than this, but initially I was just purposely waiting for everybody to be here. Yeah, if you want it next week Monday, that's good, honestly, because it gives me a lot of time and it gives you a lot of time. That's one, to study, because this review will be online and it's still the same review. It will be online and you can go through it over and over again. All right. So don't worry. When we are up to 50 people here, I'll make a poll. All right. Remind me. Somebody should be checking the number of the people online, because I know you can see it. When it is up to 50 people, tell me. Let's pick one that changes. All right. So I'll give you a question now. Look at this. I'm not giving options for this question. I'm not going to give option. Or should I? No. Someone said, yeah. Ha! They bribed you. That's bribery. Report to NYPD. Guys, look at this question. The haploid end result of meiosis 1 is called a dash. Option: spermatogonium, secondary spermatocyte, primary spermatocyte, spermatid, sperm cell. Quickly, guys. Quickly. Spermatogonium, secondary spermatocyte, primary spermatocyte, spermatid, and sperm cell. Sperm. Quickly. Quickly, guys. Quickly. I want to give you fast questions now. Quickly, guys. Quickly, guys, please. Can we take the exam tomorrow? Take it tomorrow. So that these spermatocytes, I have so many other tests coming up, and if you move it, my first week, yes, wait a second. Don't worry, we will take a poll. All right, it's okay. You take a poll. So, the haploid result of meiosis one is called a what? Secondary spermatocytes. Secondary spermatocytes. All right. Don't worry. Let's discuss this at the end of the class so that we don't alter. Good morning from India. Oh, welcome. We have Indians here. That's good. Okay, our number is increasing. I think some people are done. So I'm now pouring in a lot of questions. At what stage does a developing sperm cell begin to grow a tail, guys? At what stage? Interesting. At what stage? Spermatozoon, spermatid, primary spermatocyte, secondary spermatocyte, spermatogonium. Spermatozoon, spermatid, primary spermatocyte, secondary spermatocyte, spermatogonium. Quickly, guys, quickly. Did you see? Can you look at? This is when it start developing, you see? When it start developing its tail, the flagellum. This is the cap here. This is the head. When it starts, so you see, appearance of acromial vesicle and flagellum in a what? Spermatid. So the answer is what? Spermatid, guys. Remember, the head, I forgot to mention this thing. This is the head it uses to pierce into an egg. Acrosome. Remember acrosome. Enzyme cap over the apical half of the nucleus that contains contains enzymes that penetrate the egg. So you need to remember the acrosome, and you need to remember that it started forming a tail in what? The spermatid era. All right? Very, very important. Okay. Yes, spermatid, spermatid. You guys are so right. You guys are so right. Okay. Zoom tail. Ready to zoom. That's nothing I will not hear. Okay, look at this question, guys. Quickly. The answer is spermatid. Yes, the answer is spermatid. Please remember, spermatid. That's the answer, right? Spermatid. Look at this question, guys. I'll give you the options. This is A. This is B. This is C. This is D. This is E. At the end of meiosis 1, there are dash, whereas at the end of meiosis 2, there is a dash. A, 2 diploid 2N cells, 1 diploid 2N cell, 2 diploid 2N cells, 1 haploid N cell, 2 diploid cells, 4 haploid cells, 2 diploid haploid cell, 4 haploid cells. Let's see. According to my calculation, since the diameter of the velocity hits the equator, the answer should be C. Jesus Christ, I wish I wish I can see you saying this. Okay, these are hits differently. And I'm not the only one laughing. Come on, guys. At the end of the meiosis 1, there are dash, whereas at the end of meiosis 2, there is dash. There is dash. Honestly, it's so funny, man. Like, it's cracking me up. Okay, guys, you guys did well, but the truth of the matter is that it can be deployed for meiosis. Mitosis diploid, yes. Meiosis is what? Haploid. That's the difference between meiosis and mitosis. So any question that is diploid, that's di, two, diploid. The answer, that one is automatically wrong. So check everything. The option from A to E. Which one has anything diploid? That option is wrong automatically. Think about it. Think about it. Yes, yes. Think about it. So what is the answer? What is the answer, guys? Somebody say, oh. Okay, yes, the answer is D, guys. The answer is D. 2 haploid N cells, 4 haploid N cells. Acrosome arises from Golgi body. Yes, acrosome arises from the Golgi complex. Yes, Golgi apparatus. Yes. So the answer to this is D. 2 haploid cells, 4 haploid cells. All right, because the 2 will enter meiosis 2 and break into 4, and our ensign is wrong. So please remember that in meiosis, each parent cell produces what? 4 haploid. They may ask you that question in a different way. Remember, the question I gave you initially said, look at the question I gave you initially. It said, at the end of the meiosis 1, there are dash, whereas at the end of meiosis 2, there is dash. If they ask you this question in a different way, like in meiosis, they say in meiosis. When they tell you in meiosis, each parent cell produces what? It must be 4 haploid cell, not 2 haploid, because meiosis has meiosis 1 and meiosis 2, but the complete meiosis is what? 1 and 2. That's the complete. You understand? 1 is incomplete and 1 is 2. All right? Of course we are. Somebody say, are we going over female reproduction? Of course we are. We need to capture the male properly. Okay, guys, look at this. We would have been faster than this now, but a lot of people were in the lab, and they are still not here because this is still 23 people here. I don't know why. I was thinking that by now we have up to 60 people. So I don't think it's the lab that is holding some people. Some people are just not here. So this is the options. This. Okay. Which of the following is the most important role of meiosis in sexual reproduction? Oh, this is anatomy and physiology. We are discussing the function, the proper function of the human body and the proper structures of the human body. This is anatomy and physiology, all right? So which of the following is the most important role of meiosis in sexual reproduction? It reduces the size of the gametes. It produces at least one gamete that is mobile. It prevents the chromosome number from doubling in each generation. It ensures that each daughter cell doubles the number of chromosomes. It ensures the genetic composition of each chromosome. No, if the number is going down, then I won't take the poll. It shouldn't be going down. I should be having not less than 50 people here, for real. And we are having people from India. So why are people from America delaying? I'm telling you that for me to take the poll, the number should be 50 because I can't take the poll from minority. Minority cannot decide what happens to the majority. You understand? So if we have up to 50, and if we end up not having up to 50, then I can't take the poll. Okay? So let's go, guys. Which of the following is the most important role of meiosis in sexual reproduction? Quickly, guys, quickly. He said, it must be C. Oh, the one. Don't worry, they'll be part of the vote. So, guys, what's the answer? I need more responses, guys. Come on, let's go. Make sure you subscribe to the channel, right? Make sure if you are not subscribed, make sure you just subscribe. And later, when you rewatch this video, when you are watching it, you know, when you're at the end, just write ready at the end. Okay. So the answer, you guys are correct. Don't worry, you have to come, all right? You guys are correct. The answer is C. It prevents the chromosome number from doubling in each generation. Think about it. Normally it's 2n, right? Normally it's 2n. So if it's giving rise to 2n, 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 you understand? It can lead to what? 2n from the mother, 2n from the father. They will give you 4n. The person will become 4n. You see the point? That's why that's for mitosis. So, you know, if it happens in what happens in mitosis, if it happens in meiosis, it becomes 4n. So because of that, meiosis, no matter the breakdown, it will be n. So n from the father, n from the mother joins together to form what? 2n organism. So that's the point. So it prevents the number, the chromosomal number from doubling in each generation. Very, very, very important. It's extremely important. And that's why meiosis, it only happens in sex cell. Look at this thing, guys. Changes called male climacteric are consequence of A. Consequence of A dash is A. Please, I need us to be faster because I need to transfer to the female. I want to make sure that all these people are these people are already here so that I'll be able to transfer to the female, please. So I need you guys to answer faster. As many people as possible. Please, if you're not sure, just write not sure or write 911. You understand? Not sure or write 911. Okay, changes called male climacteric are a consequence of A or and dash. Increased secretion of estrogen, increased secretion of progesterone, decreased secretion of testosterone, increased secretion of FSH and LH, increased secretion of what? GnRH. Come on, guys. Come on. Hit it up. Also, as you guys are answering, you need to know the changes that happens in male during puberty, the deepening of the voice, the gain in the muscle mass, the growth of the scrotum and the penis, it becomes very big and large, the acne, all right? The acne, like if you see my face when I was growing up, Jesus Christ, the acne on my face, if you do like this, my acne will injure your hand. A lot of blood will be coming out from your hand. So please, you guys need to know that. I just saw the question, but I'm not going to discuss it because it's too cheap. So all these things are changes that happens in male. You should also know the changes that happens in female. Hey, have you faced disciplinary panel before in the school? Don't joke with it too. So please, the answer is C, decreased secretion of testosterone. All right, that is the answer. C, decreased secretion of testosterone. They don't shall know ambiguous. Okay, look at this question, guys. Look at this question, guys. I'll call out the options. Please pay attention, please, so that I can read it once. Which hormone suppresses spermatogenesis without affecting testosterone secretion? Which hormone suppresses spermatogenesis without affecting testosterone secretion? We have gonadotropin releasing hormone. We have testosterone itself. We have inhibin. We have luteinizing hormone. We have follicle stimulating hormone. Answer. We have GnRH, gonadotropin releasing hormone. We have testosterone itself. We have inhibin. We have luteinizing hormone. We have FSH, follicle stimulating hormone. Which hormone suppresses spermatogenesis without affecting testosterone secretion? Come on, guys, let's go, let's go, let's go. What's delaying us? Yes, the answer is inhibin that is secreted by the nerve cells. All right, that's what it doesn't affect the entire thing. All right, it doesn't affect this. It doesn't affect the entire thing, the testosterone secretion, but it affects suppresses spermatogenesis. All right, it's very, very important. Let me see. Look at this question, guys. Yes, the answer is inhibin. You're correct. You say? Can I quickly? Okay, I will. But let's attempt this question before so that I can stand on it and give you a proper explanation. All right. This is A. This is B. This is C. This is D. This is E. So DASH stimulates the interstitial cells of the testes to secrete DASH, gonadotropin releasing hormone, and LH, follicle stimulating hormone, and androgen binding protein, luteinizing hormone, and androgen binding protein, luteinizing hormone, and testosterone, luteinizing hormone, and estrogen. What was the answer, guys? What was the answer? Quickly, guys, quickly. Okay. Somebody say I'm not. Let's see this question again. So, Professor, do you know how many questions is going to be on the test? 60 to 70. Okay. I'm driving home from lab, so I won't be able to. No, that's fine. That's fine. Just listen. That's fine. Okay, so Yes, the answer is D. The answer is luteinizing hormone and testosterone. All right, so luteinizing hormone stimulates the intestinal cells of the testes to secrete what? Testosterone. So that brings me back to that question. So let me take briefly. What was the question somebody asked? Somebody said, Professor, can you briefly explain why it's inhibin? So that question says, which hormone suppresses what? Suppresses spermatogenesis without affecting testosterone. All right. So what you need to know is that inhibin specifically is produced by the Sertoli cells. All right. So, and those Sertoli cells is in the semiferous tubule. You understand? So it works using negative feedback, right, to suppress FSH. It suppresses FSH specifically. You understand? FSH is secretion in the anterior pituitary. All right. So the question is, as you said, why does it suppress spermatogenesis without affecting testosterone? Because FSH stimulates Sertoli cells. You understand? And Sertoli cells support spermatogenesis. So inhibin stops FSH, thereby stopping spermatogenesis. Does it make sense? But what causes production of testosterone is the what is it called? It's luteinizing hormone. So luteinizing hormone is usually, stimulating Leydig cell, not Sertoli cell. I need you to get the picture. So FSH stimulates Sertoli cells. Put Sertoli cells here. Let me use these two things to give an example. FSH stimulates Sertoli cells. Luteinizing hormone stimulates what? Leydig cells. And the Sertoli cells support spermatogenesis. The Leydig cells supports what? Supports testosterone production. Now, inhibin suppresses FSH. So when it suppresses FSH, this is FSH affecting what? Sperm production, but it does not affect Leydig cells. Do you understand? So FSH stimulates Sertoli cells. That's the only part inhibin can affect. You need to make sense to you. I need it to make sense to you. So if you just think about it, there are two parts in the testes. There are the Sertoli cells and there is Leydig cells. All right. FSH affects Sertoli. Luteinizing hormone affects Leydig. Those are the two things. If you can put them in your head like this, write them in a book. Sertoli cells, FSH, Leydig cells, LH. Now we are talking about inhibin. What inhibin affects is follicle stimulating hormone. Now, follicle stimulating hormone affects what? Sertoli, but not what? Leydig. And Leydig cells helps in testosterone, while Sertoli cells helps in spermatogenesis. So indirectly, inhibin can inhibit spermatogenesis, but it will not do anything to what? To testosterone, because testosterone is Leydig cells, and inhibin does not have any power for Leydig cells. All right. So I hope you understand. Don't mind me. I know my explanation is terrible, but that makes sense now. Thank you. Someone says sorry, I crashed out. Okay. I hope you guys understand it now. All right. So Sertoli, Leydig. Under Sertoli, right? FSH. Under Leydig, right? LH. Make sense? Now you write inhibin. Inhibin only affects FSH. FSH only affects Sertoli. Sertoli is in charge of spermatogenesis. All right. So this part is inhibin inhibits this part. But you see this part, Leydig cells, which is stimulated by LH, luteinizing hormone. All right. It takes care of testosterone. Inhibin does not have a say in it. So that's the thing. Thank you so much. Okay. So I hope all of us are on the same page. Look at this question. Which of the following is an androgen? I'll give you options. A. Please, if you are driving, don't type. Please, just drive. Please, just listen. All right, don't type. Thank you. Which of the following is an androgen? We have estrogen, we have progesterone, we have testosterone, we have luteinizing hormone, we have FSH, follicle stimulating hormone. Estrogen, progesterone, testosterone, luteinizing hormone, follicle stimulating hormone. Which of the following is an androgen? Quickly, guys, quickly. If you are faster, I'll finish faster. I want to jump to female. Perfect. You guys are very correct. Androgen male hormone, that's testosterone, all right? And then we ask you another question about which of the following hormones directly stimulate the development of male secondary sex characteristics. It is what? Testosterone. It is what? Testosterone. How about this question? When do the testes start secreting testosterone? When? This is A. This is B. This is C. This is D. This is E. Okay. When do the testes start secreting testosterone? In the first trimester of the fetal development, in the first trimester after birth, in the first 3 years after birth, in the first 3 years of adolescence, after the first ejaculation. Quickly, guys, quickly. I'm expecting everybody to be pouring answers. Come on, hit it up. Come on, guys, why are we delaying? One, two, three, 4, 5. Why am I having only 5 answers? If I don't have more, it's difficult to move ahead, guys. Yes, the answer is A. First trimester. The answer is A, all right? The answer is A. First trimester of the fetal development. Please, when you are saying first trimester, you need to know what you're talking about. First trimester, because they say you see first trimester of after birth. I wonder what is first trimester after birth. This is crazy. Okay, guys, look at this question. The golf ball size structure found inferior to the urinary bladder and surrounding the most proximal portion of the urethra is called the dash. We have A, seminal vesicle, B, urethra, C, bulbourethral gland, D, prostate, E, ejaculatory duct. Seminal vesicle, urethra, bulbourethral gland, prostate, ejaculatory duct. Come on, guys. Where are my people? Come on. Where are you guys? Hey, we are just in mail, oh. Before you are jumping to the bed, we are just in mail. Yeah, I said seminal vesicle, urethra, bulbourethral gland. What did I even? Seminal vesicle, urethra, bulbourethral gland, prostate, and ejaculatory duct. Yeah, just put your leg inside cold water and you will not sleep. That's what we do when we are in school those days, medical school. We put our leg inside, we will be reading like this and you will be sleeping, like nodding your head. You still hold the book. Get water with big pan and put your leg inside and you are reading. Somebody, your neighbor will wake you and say, Nchebe, Nchebe, night class. We call it night class. We go to night class that year. You know, sometimes we'll be sleeping and the book will be reading us. Yes, the answer is prostate, guys. The answer is prostate. All right. And they can ask you this question, but this one is not okay. Look at this same question, this question with the same option. Because that's what they will use to confuse you. I don't know which one will come out. I don't know if it's tomorrow. I said we'll take this thing after the class, after the stuff. The dash is the small bilateral organ found lateral to the membranous urethra. Options: seminal vesicle, urethra, bulbourethral gland, prostate, ejaculatory duct. Seminal vesicle, urethra, bulbourethral gland, prostate, ejaculatory duct. The other one is prostate, right? This one is what? The dash is a small bilateral organ found lateral to the membranous urethra. Yes, you guys are very correct. The answer is bulbourethral gland. All right, that's the answer. All right, the dash is the small bilateral organ found lateral to the membranous urethra. That's bulbourethral gland. Look at this question, guys. I'll give you the options. You pick which one is right. All right. So for this one, just tell me: is it A, is it B, is it C, or is it D? That's the question there. Yes, bulbourethral gland is correct. This is A. This is B. This is C. This is D. And this is E. Which of the following is the correct pathway of sperm cells from their formation to ejaculation? You are lying. I better than see you in the summer class. I think, yeah, I have a summer class. Better than see you in my summer class. Except if am I taking microbiology this summer? I don't know. I'll check. Because I know I have a class this summer, Monday, Tuesday, Wednesday. I will not see you in my summer class. Okay, guys. As you're answering this question, please remember that the site of maturation of sperm and storage is the epididymis. Please, I'm not going to ask you this as a question to avoid, because I want to jump to female now. The site of maturation and storage of sperm is what? Epididymis. All right? So come on, guys. What's the answer to that question? Yes, you guys are so correct. The answer is what? D. All right? Seminiferous tubule to rate testis. That's the network. Then to epididymis, where it's stored and it matures. Then it jumps out. You know, it stores there. All right? Then immediately somebody touches you. Piam, it jumps out through the ductus differential. It jumps into the ejaculatory duct, into the urethra, and outside on the ground, on on anything, or inside or whatever. Microbiology, I don't know. Really, I've not checked. I know they sent me stuff, but I've not looked at it. I'll look at it later. I always like to round up. Somebody sent me on a message, and it's asking me if we if we are going to, I'm going to postpone. So please, I'm not going to respond to that now. Please, that's the answer, all right? The answer is D. Please remember what I told you about storage and maturation, because I'm almost done. I have 2 to 3 questions and we're done with this. The innervation of the penis. Who can tell me the innervation of the penis? What's the innervation of the penis, guys? Which nerve takes care of the penis? Which nerve? Which nerve? Is it the internal pudendal? Is it the obturator? Is it the penile? Is it the ventral? Is it the external pudendal? We have internal pudendal, we have the obturator nerve, we have the penile, we have the ventral, we have the external pudendal. Which one innervates the penis? The pudendal is 2. There's internal, there's external. Okay, you said internal. Okay. Yes, you guys are so correct. Sorry, I have to be faster. You guys are so correct. The answer is internal pudendal. Please remember, internal pudendal nerve innervates the penis. Look at this question. Which of the following does not play a role in the thermoregulation of the testes? Which one does not play a role in the thermoregulation of the testes? We have the bulbospongiosus muscle. We have the cremaster. We have the pampiniform plexus. We have the countercurrent heat exchanger. And we have the datus. Yes, that pudendal is internal pudendal, right? Be specific, because there is 2 pudendals there. It's internal pudendal. So which of the following does not play a role in thermal regulation of the testes? Remember, we talked about how the testes need to be cool, right? Sometimes when you are in action, sympathetic and parasympathetic has already made the penis to rise up and it's in action. Blood gushed in, that blood will become very hot, all right? It needs to be cooled. Things that cool it. Which one is not among the things that cools it? Yeah, it's just 2 to 3 more questions for the male, and we're done for male. We already discussed the major things. That's why these ones are just little tested on the microphone quotient. Which one, guys? Yes, the answer is A. Is the bulbospongiosus muscle. It has nothing to do with thermoregulation. The thermoregulators are the cremaster, the pampiniform plexus of the veins, the countercurrent heat exchanger, the datus muscle that brings it up and makes it what? You see? Makes it like, brings it up and together to the body wall, especially when it's very, very cold. If you pour it cold water, you guys know what I'm talking about. Stop laughing. So this is the last question. This is the last question for male. This is the question here. Let me give you the options. This is A. This is B. This is C. Please, anybody that is not here, send the person a message. If you have anybody's contact, send the person a message to join in so that we'll be able to take that pool. But if you are not up to 50, we will not do it. All right? I'll just move ahead with my schedule with you. Because some people now will not come to school tomorrow and be like, oh, you said, why? Because they did and log off and went to go and sleep. Which of the following is true regarding blood testis barrier? It prevents antibodies in the blood from getting to the germ cells. It prevents heat loss from the testes. It prevents blood from getting to the testes. It prevents testis temperature at 35 degrees. It maintains testis temperature at 37 degrees. Mm-hmm. Perfect. Yes, the answer is A. It prevents antibodies in the blood from getting to the germ cells. All right. Aha, that's the testis barrier by the nut cells. Nut cells will protect. It's protecting the testis with its life. All right. So that's for male reproduction. You should go watch my reproduction video. There are a few other questions that I didn't mention there, but these are the major questions. So please don't fail to go watch that video, right? Especially for your finals. Okay, so let's jump to the female reproduction very fast. This one will be much faster because initially we were discussing to wait for other people. Are you ready? We can't do the poll. We are 20-something people here. Class is 80. 20-something people cannot decide for 80 people. Sorry. I've already told you, if we are not up to 50 and I'm done with this thing, good night. So we'll see it in the morning. For real. It's not my fault. You need to talk to your classmates. I can't be here and they're not here. These people don't even understand what I'm saying. Hold on, I want to start. Okay, so let's start, guys. Yeah, for the final, I'll be doing review from because this final is not only your class. There are a lot of other classes. So whenever I post a a live review, you should join it if you are free. You understand? Because the information, definitely you need it. I'll be doing live review on Friday. I'll do on Sunday. You understand? And some of the topics there will be your final topics also. So you need to, make our time to join. That's why you need to subscribe to the channel and click the notification bell. If you've not done it, don't do it now, please. Follow the channel, click the notification bell. It will also remind you, all right? And also, you see that thing like this up there, you need to click it. I need it to increase. There is just 6 there. When you do those things, the algorithm will be able to catch you so that whenever I go online, even if I don't post the link for you, you'll be able to meet. Some of you will still do pathology, some of you will do microbiology, some of you do pharmacology. I take these courses and I'll discuss them live here. All right. He said I should make a cool intro. I don't know how to do all these things. I don't know how to do all those things, honestly. Like, take my time to make all these videos, and nah, honestly, I'm not a very good content creator. Hey, what's up, guys? Nchebe here, back with a new life. Nah, this got me. He said you'll be famous. Okay, I already have 50-something thousand subscribers. All right. So maybe when I get to 100,000, when YouTube gives me that play card, that's 100,000. Hey, I will know that I'll start doing all those things. For now, I'm all natural. Okay, so let's look at this question, guys. No, 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 no. If I don't take the pool, then it holds tomorrow. That's the point. The pool is just for me to know if it should be shifted. The default is tomorrow. All right. Okay, guys, please look at the question. Let's focus on this question, not the pool. The pool is not important to me. What's important to me is for you to understand what we're doing. Look at this question again, all right? And give me the answer quickly, guys, quickly. During the dash, the uterus is tented, erected, and the cervix is withdrawn from the vagina. Typically, the clitoris is engorged and the labia are bright red to violet due to hyperemia. Which phase? Excitement, detumescence, orgasm, resolution, pregnancy. Which phase, guys? Energy, energy. Okay, now we are up to something. Energy, guys, energy. Pour in energy. Pour energy, energy, guys. Energy, guys. Excitement. Please, it's excitement. They will describe this thing to you. I'm telling you. That's why when I'm saying those things, somebody was telling me I'm saying evil. You understand? But it's not literally evil, right? It's actually the right thing. Okay. I don't know how to yell. Yeah, Alex, I don't know how to hide. I don't know how to hide. It's yeah, he's laughing. So please look at this question, guys. During the plateau phase of the sexual response, just try your best. I will. During the plateau phase of the sexual response, the glands and the clitoris swell as the deep arteries dilate and the dash engorge with blood. Alex, go there, go there. Alex, I'm hyping you now with this question. I'm hyping you. During the plateau phase of the sexual response, the glands and the clitoris swell as the deep arteries dilate and the dash engorge with blood. Options: uterine walls, vaginal walls, corpora cavernosa, corpus spongiosum, and vestibular glands. Which one? Uterine walls, vaginal walls, corpora cavernosa, corpora spongiosum, vestibular glands. Which one, guys? Which one? Which one is engorging with blood? You know, in the male, you see the trabeculae engorge with a lot of blood, right? Now, in the female, which one engorges with a lot of blood? Is it wall, uterine wall? Is it vaginal walls? Is it corpora cavernosa? Is it corpora spongiosum? Or is it vestibular glands? Which one? Yes, you guys are so correct. It's corpora cavernosa. Please, you cannot forget this. You know, the female reproduction is a little more difficult than the male. I think I don't know, but I think the male is more straightforward. Yes, it's corpora cavernosa. All right, please look at this, guys. The dash sometimes expels copious fluid similar to prostatic fluid, which constitutes the female ejaculation. A. Prostate. B. Paraurethral glands. C. Bulbourethral glands. D. Vestibular bulb. D or E. Vaginal epithelium. The dash sometimes expels copious fluid similar to prostatic fluid, which constitutes the female ejaculate. A. Prostate. B. Paraurethral gland. C. Bulbourethral glands. D. Vestibular bulb. E. Vaginal epithelium. Oh, this one is short option. That's why I'm reading it. All right. Don't worry. I'll be writing from the next ones. A. Prostate. B. Paraurethral glands. C. Bulbourethral glands. D. Vestibular bulb. E. Vaginal epithelium. Which one expels that copious fluid? Yes, the answer is B. You guys are so right. The answer is B. It is the paraurethral glands. No, I don't like this question. Okay, this question. Let's hurry up because I need to show you some pictures, guys. I'll show you some pictures at the end of this discourse. You understand? Because you are going to see some pictures. It's very, very important that you be active and engaged. Very fast, guys. Which phase of the menstrual cycle is one associated with menstrual cramp? Proliferative, secretory, follicular, premenstrual, luteal. Quickly, guys. Quickly, guys. Which phase of the menstrual cycle is the one associated with menstrual cramps? When do you have menstrual cramp as a girl? That's the question there. As a lady. Okay, I should repeat. Proliferative, secretory, follicular, premenstrual, and luteal. Come on, guys. Come on, come on, come on. Let's talk. Let's go. Let's go. Let's go. Let's go. Let's go. Come on. Yes, the answer is premenstrual. All right. Remember, there's a difference between the menstrual cycle and the ovarian cycle. This is the menstrual cycle. What happens in the uterus? All right. This is the menstrual phase where you are shedding. Then this is where you are growing again around 2 to 3 tick. All right. That's the proliferative phase. Then this is the secretory phase. It gets to almost 5 to 7. Then it starts it's preparing to shade. All right. That's the premenstrual phase. At this time, the person is having a lot of what? Abdominal pain. All right. Now, if you're talking about the ovarian cycle, this is the ovarian cycle diagram. And remember the hormones. You see the hormones there? This is the ovarian cycle diagram. What happens in the ovary? All right. This is the follicular phase and this is the luteal phase. All right. This is the ovulation area. All right. Between the follicular phase and the luteal phase, that's day 14. This is everything that happens, and this is the hormone that controls it. I believe that you guys will remember this because you'll be tested on this a lot. All right. Especially in your final. So it's premenstrual. Look at this. Look at this, guys. What's the answer? Look at the options. The option is gonadotropy, GnRH is A, estradiol and progesterone is B, estradiol is C, progesterone is D, androgens is E. What hormone inhibits the secretion of FSH and LH during the female Sergio Secco. A, GnRH. B, estradiol and progesterone. C, estradiol, and estradiol. Then D, progesterone. E, androgen. There's no inhibin induction, no. We already discussed inhibin now. There's no inhibin in this option. Option A is GnRH. B, estradiol and progesterone. C, estradiol. D, progesterone. E, androgens. Help me out, my word. No, the answer is estradiol and progesterone. Remember, follicle stimulating hormone, LH, luteinizing hormone, all these hormone that helps in what? Ovulation and, in other things before the ovulation, like everything that helps in folliculogenesis, everything that helps the follicle to develop and come out, right? So estradiol and progesterone helps to stop it. Stop it, because especially when you are pregnant with progesterone, you don't want FSH and LH to start dropping eggs. All right, so the answer is estradiol and progesterone. The answer is B. Estradiol and progesterone. The answer is B. Okay, I think this female stuff is more easier. Look at this question. Please don't take alcohol and smoking, because smoking ruptures the placenta. Anyway, that's by the way, and it causes previa. Look at this question. Which of these hormones, the hormone levels reaches its maximum during the luteal phase? We have the GnRH, we have the FSH, we have the LH, we have the progesterone, and we have the estradiol. Which of these blood hormone levels reaches its maximum during the luteal phase? Which one? Which one, guys? Yes, it's progesterone. I thought a lot of people will fail it too. It's actually progesterone. Guys, it's not GnRH. It's not FSH. It's not LH. It's not estradiol. It is progesterone. That's what gets to its maximum. All right. Aha. Okay. Now look at this. All right, this thing is lagging. It's beginning to lag. There's a great joy when you get an answer correct. During the follicular phase, granulosa cells secrete dash, which stimulates secretion of dash. During the follicular phase, this is A. This is B. This is C. This is D. And this is E. During the follicular phase, granulosa cells secrete dash, which stimulates secretion of dash. Hmm? Come on, guys. Yes, you guys are so correct. The answer is A. It's estradiol and luteinizing hormone. Follicular phase. All right. Remember, LH has to surge for that follicle to burst and come out. That's ovulation. Sorry. I have to wait for people to respond. Don't worry. When I give you some pictures now, you wake up properly. Look at this question. For people that are falling asleep, this question is for you. In the adult ovary, more than 90% of the follicles are found as dash. A. Primary follicles. B. Secondary follicles. C. Tertiary follicles. D. Graphian follicles. E. Primordial follicles. In the adult ovary, more than 90% of the follicles are found as dash. A. Primary follicles. B. Secondary follicles. C. Tertiary follicles. D. Graphian follicles. E. Primordial follicles. Yes, it is primordial. Guys, it is primordial. More than 90% in adult is what? Primordial. All right? It is primordial. Please don't forget that. When does oogenesis begin? When does oogenesis begin? When? During embryonic development, at birth, during TELAC, during puberty, during MENAC. Yes, the answer to that is primordial, all right? When does oogenesis begin? During embryonic development, A, at birth, B, during TELAC, C, during puberty, D, and during MENAC, E. Come on, guys, let's go there. Let's go there. When does oogenesis begin? Yes, the answer is A, during embryonic development. You cannot forget this. During embryonic development. All right. Look at this question. Yes, embryonic development. That's the answer. Look at this question. Which follicle stage is characterized by the development of a corona radiata? Which follicle stage? We have primary, we have secondary, we have tertiary, we have Graphian, we have primordial. What's the answer, guys? Quickly, guys. Quickly, guys, please. Which stage? Which follicular stage is characterized by the development of corona radiata? Please, if you are not sure, write you are not sure. Quickly, guys, quickly. Not sure. Okay, so please, it is tertiary. Please, it is at the tertiary stage where coronal radiator is formed. This is the tertiary. Where is it? Where is that diagram? Look at it. This is the primary. This is the secondary. All right. Then this is the tertiary. This is the stage where coronal radiator is produced. All right, or formed. This is the particular place. So please, I really need you guys to put this in your head. Remember it. It's extremely important. All right. So it's already lagging. Immediately I shared, it started lagging. Yes, the tertiary, please. The answer is tertiary. If you see, so look at this question. The female reproduction, actually, the questions are very straightforward. I think the male is more complicated. The male, it seems to be more complicated because most of the questions I'm seeing here is more straightforward questions. Look at this. This is B. This is C. This is D. And this is E. Quickly, guys, quickly. I really need us to be faster because there are some things, questions. I need to show you some diagrams. At the end of this discussion, I have to show you some diagrams. And if I don't show those diagrams, then you go look it up yourself. You need energy? Go and take Gatorade. I heard Gatorade gives energy. What is a follicle composed of? An organ in the ovary, an oocyte enclosed in follicular or granulosa cell, a group of granulosa cells, a group of follicular cells. Which one is the answer, guys? Quickly. More energy. Somebody say, let's give the person energy. All right. Take care of yourself. Please try to look up the pictures because I will discuss pictures. And when you wake up, go look at the ending part of this discourse. All right. Because at the end part, at least the last 10 minutes, I'm going to show some pictures that are very relevant to your exam. What is the follicle composed of? Yes. If you say C, you're correct. If you say C, you're correct. It's composed of an oocyte enclosed in follicular or granulosa cell. All right. An oocyte enclosed in follicular or granulosa cell. That is the answer. So if you say C, you are correct. If you say C, be happy. Okay, look at these guys. Look at this. Incoming missile. Is A. Yes. This is B. This is C. This is D. And this is E. In ovulation, after expelling the oocyte, the follicle becomes a dash and secretes dash. What's the answer? In ovulation, remember when the follicle pushes out the oocyte, right? It's assuming that there's one sperm that will come and fertilize that egg, that oocyte, right? So if it assumes that, what do you think it will do? No, I wasn't dancing. I'm trying to give myself more energy because you guys are not responding very fast. So I'm trying to give myself more energy. So after expelling the oocyte, the follicle becomes a dash. So immediately it pushes it out, it's now preparing for pregnancy. So because of that, it will start secreting what? Estrogen and what? Progesterone. Those are pregnancy hormone and female hormone. All right. So the answer is corpus luteum, estrogen, and progesterone. The answer is D. If you choose D, you can shout. All right, as far as your mom is not close to you. Look at this question. They always try to confuse everybody with this question. Trust me. Trust me. I am sure some of you, they want to confuse you with this question. Most ovulation home kits measure a surge of which hormone? We have FSH, that's follicle stimulating hormone, luteinizing hormone, estradiol, progesterone, human chorionic gonadotropin, HCG. We have FSH, LH, estradiol, progesterone, HCG. FSH, LH, estradiol, progesterone, HCG. Most ovulation home kits measure a surge of which hormone? Let's go, guys. Let's go. This is a giveaway. This is a giveaway. FSH, LH, estradiol, progesterone, HCG. Which one, guys? This is a giveaway. Come on, guys. Keep going. Okay, guys. If you say LH, say with me. If you say LH, you are correct. LH, you are correct. LH is correct. It's luteinizing hormone, not HCG. And I'm sure the people that are not in this review, if they see this question tomorrow, if they see this particular question tomorrow, 90% of people that are not here will choose HCG. But the answer is not HCG. They are telling you ovulation. Ovulation. Not pregnancy. If it is pregnancy, they're talking about HCG. But this time, ovulation. What causes ovulation? LH, luteinizing hormone surge. Remember, HCG, pregnancy home kit. LH, ovulation home kit. You cannot forget this thing now. They just put it there to confuse you. Trust me. The bathroom break. No, I'm not drinking water today. So look at it. Is that I should repeat? Yeah, so that question is asking you, okay, hold on, let me put the answer to this one so that when people are now responding, then it's exciting because that's how they confuse a lot of people. Then I cannot repeat it, all right? So this is A. Sunday league. My leg is broken now. Now I'm incapacitated. This is C. This is D. And this is E. When does an ovum finish meiosis? During fertilization, during implantation? Why in a secondary follicle? Why in a primary follicle? Why in a tertiary follicle? Now, somebody said I should repeat that thing I discussed initially. HCG, human chorionic gonadotropin, is a hormone that comes initially when somebody is pregnant. If you do pregnancy test, urine test, you will notice HCG, high level of HCG around day 7 to day 14. All right, it holds pregnancy initially until progesterone starts getting much bigger and bigger. And we also use it to check for ectopic pregnancy, because if you if it's a real pregnancy in the uterus, right, HCG will hold it till day 14, right, and immediately progesterone will take over from HCG to hold that pregnancy. So as progesterone takes over, the HCG will start dropping. 1,000 units, 500 units, 200 units, it start dropping. But for ectopic pregnancy, if it's a pregnancy outside the uterus, right, HCG will be produced to hold that pregnancy. But in day 14, in day 15, in day 16, in day 17, progesterone will not be coming out because progesterone is not seeing a baby in the uterus. It won't be produced. Like it won't be coming out. All right. Since it's not coming, coming out to hold that pregnancy, HCG will keep multiplying to keep holding the pregnancy, thinking that person is pregnant. But that pregnancy is actually outside the womb, which is what ectopic. All right. So HCG, pregnancy kits, LH, ovulation kits. Remember that. Yes, fertilization. It is when during fertilization that the meiosis 2 is complete. All right. Initially, it's arrested at what? Okay. It is arrested at what, guys? Where is it arrested? Look at this question. Which stage of meiosis is an ovulated egg arrested in? Where is it arrested in? Answer. No. If you, my highlight wasn't in Man City. You know, I played in Man City as a teenager, but I was bought by Madrid, 100 million. All right, so I played in Madrid. You know, so go to Madrid, you will see my highlights. Yeah, Real Madrid, not Atletico Madrid. So which stage of meiosis is an ovulated egg in? Prophase 1, metaphase 1, telophase 1, prophase 2, metaphase 2. Clapping. The option: prophase 1, metaphase 1, telophase 1, prophase 2, metaphase 2. Prophase 1, metaphase 1, telophase 1, prophase 2, metaphase 2. Quickly, guys, quickly. We are wasting time. We are wasting too much time to answer. If you don't know it, just put not sure, please. Oh, for female, I just have like roughly 10 questions. Then I'll show you some diagram and that is it. All right, so we're almost done. Yes, please, the answer is metaphase 2. All right. Yes, it's fine that you said not sure so that you'll be able to remember it. The answer is metaphase 2. All right. Not meiosis 2, metaphase 2. All right. It will stop there. So if you see a lady just walking around, all her this thing are in metaphase 2. They stop in metaphase 2. But if you now do something with the lady, right, and your sperm enters that lady and swims and see the egg, the acrosomal part of the thing penetrates, right, immediately it enters, that egg will move from metaphase 2 to what? Anaphase 2, telophase 2. You just complete, all right, and become an embryo. You get it? So that's what we are talking about. So it's arrested in metaphase 2. All of them stays in metaphase 2. If it goes out, if it breaks down and the person is not pregnant and sees his period, that is metaphase 2. The egg is just in metaphase 2. It cannot progress beyond there. It needs a masculine sperm to, you know. Aha. What does the term menstrual cycles specifically refer to? I'll give you options, guys, so relax. What does it specifically refer to? This is A. This is B. This is C. This is D. And this is E. Quickly, guys. What does the term menstrual cycle specifically refer to? The sequence of events from fertilization to giving birth, the events that recur every month during pregnancy, the cyclic events happening from puberty to menopause, the cyclic changes in the uterus determined by shifting hormonal changes, the cycle changes in the ovaries determined by shifting hormonal changes. Quickly, guys, quickly. More. I need more responses. Yes. Yes, the answer is D, all right? The answer is D. Cyclic changes in the uterus that is determined by shifting hormonal changes. Yes, the answer is D, all right? Look at this question very fast, guys. What causes hot flashes in the climacteric period? That's period immediately before menopause. The woman will start having hot flashes. Huh? This is C. Very fast, guys. Very fast, very fast, very fast. This is D. Okay, so I'll give you just A to D instead of E. During climacteric, what can cause hot flashes? Vasoconstriction of cutaneous arteries, vasodilation of cutaneous arteries, vasodilation of cranial arteries, vasoconstriction of cranial arteries, vasodilation of facial arteries. All right, take care. Which one is the answer, guys? Yes, the answer is B, vasodilation of cutaneous artery. You cannot forget this. I have few questions to go. You cannot forget this. And you cannot also forget that the cessation of menstruation is called what? Menopause. You understand? You can't forget that. Look at this. What is this called? What are the midlife change in estrogen and progesterone levels referred to as? What is it referred to as? A, climacteric. B, atresia. C, menarche. D, puberty. E, apoptosis. Sorry, menopause is not in the option. We have climacteric, we have atresia, we have menarche, we have puberty, we have apoptosis. No, that is fine. Just pick the answer from. Okay, you've picked. Come on, guys. Come on, guys. Come on now. You guys are slowing me down, man. What's happening? What's happening, guys? Menopause. No. Answer is climacteric, atresia, menarche, puberty, apoptosis. Oh, I lagged. Sorry. It's my laptop. Climacteric, atresia, menarche, puberty, apoptosis. Yes, it is climacteric. Huh? Extremely important that you guys know this. It's climacteric. Look at this question. The appearance of a pubic and axillary hair is characteristic of which stage of puberty? Menopause, climacteric, telarche, puberty, menarche. Menopause, climacteric, telarche, puberty, menarche. Come on, guys. Come on. Yeah, you should have time to study. So it is what? Pubic. Yes, it's pubic. All right. Pubic, 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 pubic. All right. Please don't forget. Which hormone acts primarily on the uterus? Its primary place is on the uterus. Which hormone acts primarily on the uterus? Estrogen, androgen, progesterone, follicle stimulating hormone, luteinizing hormone. Which hormone acts primarily in the uterus? Estrogen, androgen, progesterone, FSH, and luteinizing hormone. Estrogen, androgen, progesterone, follicle stimulating hormone, and luteinizing hormone. Come on, guys. Which one? Yes. You guys are so correct. The answer is what? Progesterone. Yes, the answer is what? Progesterone. I am lagging badly. I am lagging badly. Sorry. My laptop is crazy. I'm lagging badly. I think I have to be speaking slowly. Slowly. So look at this. Yes, the answer is progesterone, not estrogen. No, progesterone. Look at this question. Which of the following is considered a feminizing hormone? Which one is a feminizing hormone? We have this as option A. We have this as option B. We have this as option C. We have this as option D. Then we have this as option E. Which of the following is considered a feminizing hormone? Which one? Somebody say E or C. Please, the answer is estrogen, all right? The answer is E, estrogen. Okay, so I have very few questions to go. Very, very few questions to go. Look at this. The answer is estrogen, guys. I know I'm lagging. I'm sorry. Look at this question. What is the earliest sign of puberty in females? The earliest sign. Hmm? This is A. This is B. Are you sure? This is C. This is D. So which one? I think so. Which one? Okay. So yes, the answer is the onset of breast development, guys. The answer is onset. Sorry, I was trying to check up some questions. The answer is onset of breast development. Please, this one, I don't have time to read out this question. They say, where are follicles located? Please, when they ask you follicles, about the location of follicles, it is in the cortex of the ovary. All right. It is in the, not the medulla, it is in the cortex of ovary. It is in the cortex of ovary, not just ovary. Ovary has cortex and has medulla, all right? It is in the cortex of ovary. Now, they will ask you this question. They may ask you this question. What determines the breast size? Look at the options. This is A. Yes, follicles are located in the cortex, yes. This is B. This is C. And this is E. What's the answer? What determines the breast size? Yes, you are so correct. The answer is A. It's the amount of adipose tissue, all right? That's what determines the breast size. Look at this one. I will just read this option. So pay attention. When do mammary glands primarily develop within the breast? Mammary glands during the last weeks of fetal development, at birth, during infancy, during puberty, during pregnancy. When do mammary glands develop primarily within the breast? During the last week of fetal development. That's A. B, at birth, that's B. C, during infancy. D, during puberty. E, during pregnancy. Come on, guys. Come on. Let's. Exactly. You guys are so right. The answer is pregnancy, all right? Look at this question. Look at this question. No, not puberty. Please. The answer, mammary gland develops in the breast during pregnancy, not puberty. All right? Yes, it's pregnancy. So please try to read this very well so that you'll be able to answer properly. That's A. This is B. Yeah. This is C. This is E. D. Then this is E. The dash are found in both male and female external genitalia, but the dash is only found in the female. What was the answer? Yeah, please, if you are not sure, write not sure, right? Or you choose an answer. Dash are found in both male and female external. So what I want you to do is, when you see options like this, just think deep and tell yourself, if I meet this question, assuming Nchebe did not do this review now, and suddenly I see this question in the exam, what should I choose? Will you write not sure? No, but for me, you can write not sure, right? Okay, no shame in it. So the truth of the matter is that the corpora cavernosa is found in both male and female external genitalia. All right. is both found. Corpora cavernosa is found in both male and female. So A, B, C is part of the equation. D and C is out. D and C is out. A, B, C is there. Okay, so but the dash is or are found only in the female. Urethral orifice, is it not found in the male? It is there, so A is out. Bulbo urethral gland, is it not found in the male? It is there, so B is out. Vestibular bulbs, is it found in male? No, so the answer is C. So the answer is corpora cavernosa and also vestibular bulb. Make sense? So that's C. You can't forget this. You can't forget this. Okay, guys. I think that is it. Okay, no. One more. Last question, please. Last question before I go to pictures. Last question. Look at this question. After puberty, which epithelium lines the vagina? I'm not supposed to give you options in this one, honestly. After puberty, which epithelium lines the vagina? We said cuboida is what is there before puberty. Which one lines the vagina? Is it simple squamous epithelium? Is it stratified squamous epithelium? Is it transitional epithelium? Is it simple columnar epithelium? Is it simple cuboidal epithelium? Where? Remember, this is metaplasia. That's changing from one to another, but this is physiological. All right. And when I was discussing this with you, I told you about pathological metaplasia, where pseudo-stratified epithelium of the lungs changes towards stratified squamous. All right. So yes, the answer to this question is what? Stratified squamous epithelium. Simple squamous is usually in the alveolus. Transitional is usually in the bladder. And simple columnar is usually in the digestive system tract. Simple cuboidal is usually where you get water, which was originally in the vagina, all right? More in the kidney and all those places where all these glands, and children, before puberty. Okay, so that is it. Let me see. Okay, so are you ready for the images? I want to give you some images, guys. I want to give you some images. So for this, as usual, what I usually do is to open Word. This one, my laptop is slowing like this. Are you sure Word will be able to open? Let me see now. I was supposed to make a video, but I couldn't because of the lagging. He said I should hold off. I wish I could. But unfortunately, you guys are not here to, you guys are not here to respond. Doesn't mean you guys are here. We would have even make that decision. Let for me alone, I don't mind. Like, I don't mind next week. I don't mind anytime. Because we are done with what we have. The only thing that remains for you guys is special senses. I'm supposed to make a video of special senses, but I couldn't because of this laptop. All right. So, but I will get somebody's laptop to do that video. So, guys, look at this diagram. Look at this diagram. I'll give you the question. Brace up for it. I know I'll be lagging so much now. Anytime I share something like this, I'm lagging. We move the exam for next week. We didn't even have a connector assignment to practice. Come on, don't say that. Don't even start getting reasons. You have this thing. You don't need connect assignment to practice anything. Look at this question, guys. You are practicing with me right now, right? Like for example, that's practice. You should be done with everything in what is it? Endocrinology, all right? And here I finished male now. I'm female, all right? As if you guys are up to 50, we would have done this pooling. We would have done this pool, but I don't want to make decision based on few people. So look at the question, guys. That place, what is the name? Come on, guys. I need everybody to pour answers. We have the menstrual phase, we have proliferative phase, we have secretory phase, we have follicular phase, we have luteal phase. We have menstrual, proliferative, secretory, follicular, luteal. Come on now. Come on, people. Come on, come on, come on, come on, come on, come on. What's happening? You guys are not giving me the energy I need. You know me, I work with energy. The options, I shouldn't give you options for you to know this answer. Come on. You don't need an option, for real. Look at the thing. You are supposed to know this diagram because I was sharing it and sharing and sharing. Look at the diagram. Day 1 to day 5 is what? That's what they're asking you. Of course, menstrual. Day 1 to day 5 is menstrual. So some people are saying follicular phase. Did somebody say follicular phase? This is a menstrual cycle that they are asking you. This is not a ovarian cycle. Remember ovarian cycle when you're talking about follicular, when you're talking about luteal. Here we are talking about menstrual. So because they may, okay, let me show you an example. Let me show you something. You see this diagram? They may decide not to give you this diagram. Instead, they'll give you this diagram. Did you notice that something changed in this diagram? Something changed in this diagram. Now they are giving you from day 5 to the 13. You say I failed. No, that's fine. It's good that you didn't get it now, but you get everything. Exactly. Thank you. Proliferative phase. You see, day 1 to day 5 is menstrual phase. Day 5 to day 13 or day 14 is proliferative phase. And after proliferative phase, what do you have? You have the secretory phase. You see? Premenstrual is at the ending. So you need to remember this, guys. You really need to remember this diagram because they may give you this diagram to confuse you, but don't allow yourself to be confused. Okay, look at this one. There's everybody. Are they sleepy? You can't be sleepy at this last hour. This is the time you cannot afford to be sleepy. So look at this, guys. The question. Look at the question. The phases, day 1 to day 5 is menstrual. That's when the person is bleeding. From day 5 to day 14, all right, from day 5 to day 14, that's proliferative, is growing back. The bed is setting up. Thickness is happening. Start growing back. From day 14 to the 27, that's what we call we call it secretory phase. All right. And in between day 27 and the menstruation starting, that's what we call premenstrual. That's when the pain starts. All right, but that is menstrual cycle. That's menstrual cycle. Look at this diagram I gave. Now, this diagram is what? It's ovarian cycle. Actually, it's actually ovarian cycle. So in this diagram, they're asking you this particular place where they are. What phase is it? What phase? So yeah, that's what you need to know. Ovarian cycle. What are the phases of ovarian cycle? What are the phases of menstrual cycle? Menstrual cycle, we say the phases is menstrual, proliferative, secretory, then premenstrual. That's 4. Sometimes we don't even count premenstrual. Then the ovarian phase, ovarian cycle. What are the phases? Follicular, luteal, correct? In the middle is ovulation. So the first part, that first part now is what, guys? Come on now, guys. You guys are giving me low energy. What is happening? Oh, maybe I'm lagging a lot. Sorry. So let's go, guys. Let's go. Let's go. Let's go. Let's go, guys. Sorry. My audio is lagging. Sorry. Let's bear with me. Bear with me. We are almost done. Yeah. So that first, this one is called what? That place is called what? I'm lagging. That first part is called follicular. Yes, you are correct. Follicular. Then the second part is what? They may give you the second part. That second part is what? Is luteal. 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 All right. Second part is luteal. Okay. Look at this diagram. For the female, this should be the last diagram. Look at this diagram, guys. Yeah, the first one, that's one we did. The first one is follicular. The second one is luteal. So when you are talking about ovarian phases, that's what happens in the ovary. You're talking about the folliculogenesis, all right, and the luteal phase. In between them is what? The ovarian ovulation. But when you're talking about menstrual phase, cycle, you talk about the menstruation phase. That's the menstrual phase. You talk about the proliferative, you start growing back, the secretory, then the premenstrual. So look at this diagram, guys. Look at this diagram. You see, I'm not going to take time to start giving you from one to this thing, right? But they can give you anyone. That's just what I mean. They can give you anyone. So, guys, what is the second part of the? What is the second part of the follicular phase? I don't understand what you're asking. Are you talking about that diagram? It has 2 parts. We have the follicular phase and we have the luteal phase. In between them is the ovulation, where ovulation happens. All right. I hope that's what you're asking. But if not, you can ask the question properly again. So look at this diagram. They can ask you 1, 2, 3, 4, 5, 6, 7. So I'm not going to be asking you that. Number 7 is what? Corpus albicans. That number 7 is what? Corpus albicans. All right. That's when it started what? Degenerating. All right. Very, very important. Then number 1 is primordial. Number 2 is primary. Number 3 is secondary. Number 4 is tertiary. Right? And it continues going that way. It's continuing going that way. It's very, very important that you people understand this thing from primordial to corpus albicans. Extremely important. All right. Let me see. You said what? Number 6 and number 7. See, from number 1 is primordial. Number 2 is let me see. Number 2 is primary. Number 3 is secondary. Number 4 is tertiary. Number 5 is the mature follicle itself. Number 5 is that mature follicle itself. Then number 6 is number 5 is mature follicle. That's what it's called, which houses the oocyte. Then number 6 is corpus luteum, and number 7 is corpus albicans. So you need to know 1 to 7. All right, extremely important. Okay, so let me go to the mail quickly before I leave you to go. I know you want to leave me. All of you are already saying in your mind. Okay, no problem. Take care of yourself. So let me give you guys few diagrams. Let me see if there's any diagram you need to know for the mail. Just a moment. Oh yeah. Oh, thank God, I remembered. Thank God, because if I didn't show this, some people will get mad at me. So look at this guys. Look at this. Okay, look at this, guys. You need to know A, B, C, D, E, and F. You need to know this, guys. It's every slide is this. This is not slide. I'm showing you things that you need to know. All right, please. You need to know this thing. I wouldn't have time to start asking you. He said, could there not be visuals? Have you ever seen any medical exam that there's no visual? You just the truth about that, the visuals are always more important because if you just look at it, you know the answer. You understand? If you look at it, you know the answer. If they ask you now, where do sperm undergo maturation? Look at, okay, good. Let me ask you this question. Thank you. Let me ask you this question. If I give you this diagram, for example, and ask you, yes, now visuals are also in finally. Visuals are in your final exam. Where is that final exam pass question? I'll do review for you guys. Don't worry. There's visuals, oh, even in your lab. So the thing is, they say, where do sperm undergo maturation? You know it's epididymis, but which one is epididymis in the diagram? That's what they're asking you. Everything in female is complex, but male is more. There are more questions in males, because males are not the default. The default setting is the female. All right. I don't know how to explain that for you, but yes, the answer to that question is C. Epididymis is the C. Where is testosterone produced, guys? I don't know. I don't put all those things in my head now. Go and check now. That one is your duty as a student. Yes, guys, that's correct. That's correct. That's semiferous tube. Yes, that's very correct. Look at this. Which structure is generally called to sterilize a male? Which one? Okay, trying to. Okay, I've seen what I'm looking for. Yes, the answer is F, the Vasa differential. The answer is F, all right? Yes, the answer is F. Let's hold on a moment. Trying to make sure you get everything you need. If they give you this particular question, look at this question. Look at this diagram. They give you this diagram. Are you able to identify everything here? Are you able to identify that thing, the things I need you guys to go to also look at? You need to look at it because they will ask you some little, questions from things like this. You need to know, and these are basics. These are basics. Let me give you a question here so that we know if you understand this diagram. No. You say, what is D? I can't even remember the one I gave you again. Later I'll check. Look at this. Follicle stimulating hormone targets which of these organs? Which of the organ does FSH target? You say easiest diagram. Good. You see, diagrams are actually easier because you just look at it. If you know it, you know it. You know it. You see, somebody is activated. Somebody is getting it right. Yes, the answer is E. The answer is E. How about this? Hormones from which organ have the greatest effect on the basal metabolic rate? Which one produces a hormone that has the highest effect? Yes, diagrams are easier. Students are always praying for diagrams because what can anybody ask? So, what was the answer, guys? Oh, you guys are 14. Interesting. Some people will see this question, they're going to more than start wondering. How did this question come into existence? They'll say, Nchebe didn't talk about this question. Nchebe didn't talk about this question. Yes, thyroid. Thyroid is B. Please, thyroid is B, not D. Look at this question, guys. Look at this question. Look at this diagram. Look at a question here from this diagram I gave you. Which structure facilitates between A and B? Which structure facilitates between A and B? Let me give you the options. You're welcome. See the options here. These are the questions they will test you on. Maybe this A and this is B. You see how my this thing is so slow? This is C. And this is D. Someone say B, 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 B. Yes, yes. Come on, guys. Between A and B, which one? Yes, everybody. Oh boy, now I need that water. Hey, God. Oh, everybody is saying, let me see. Is that diagram? Hypophyseal. No, no, no. Guys, the answer is high. No, the answer is A, not B. The answer is A, not B. It's hypothalamo hypophyseal tract. It's actually a tract. All right. I need you to go back. Yes, please. Oh, I'm not going to take time explaining this thing, but I need you to go back because I noticed that some of you were not in the endocrine class, endocrine review that I did. I said, no, the answer is A, hypothalamo hypophyseal tract. That hypothalamo must be there because to show that it's actually a tract that's coming from the hypothalamus, it must be there. All right. If you need more explanation, go and look at the endocrine video. Now look at this one. Now let me bust your bubble. Let me bust your using the same options. Use the same options and give me what is the answer to this one. Use the same options I gave above. A, hypothalamo hypophyseal tract. B, the nuclei of paraventricular nucleus. C, the nuclei of supraoptic nucleus. The zona reticularis, the hypophyseal portal system. What was the answer? What was the answer? Okay, so let's not waste time. Hypophyseal portal system is hypothalamus and anterior. Hypothalamo hypophyseal tract is the hypothalamus and the posterior. You understand? Because of the neurons, that's why there is tract in it. Hypothalamus and the posterior, and hypothalamus and the anterior. The hypophyseal portal system is hypothalamus and the anterior. So this question that says C and D, C and D. If you notice, C and D is talking about, they say, what structure facilitates communication between C and D? That one is the hypophyseal portal system. Please, I'm not going to repeat it. C and D is hypophyseal portal system. And the other one I asked you was what? Was A and B is hypothalamo hypophyseal system. You understand? A and B is hypothalamo hypophyseal system. All right? So hypothalamo hypophyseal system is talking about A and B. You understand? Hypothalamo hypophyseal system is talking about the hypothalamus and the posterior. That's A and B. And the posterior. You understand? But C and D is hypophyseal portal system. That's the hypothalamus and the anterior. If there's posterior, is tract, because the hypothalamus from the nerves, it stores those two hormones in the posterior. That's why there is a tract in it. So if you see tract, you are talking about the posterior and the hypothalamus. But if you see just normal hypophyseal portal system, you're talking about the hypothalamus and the anterior. Do you understand? And the anterior. Okay, I'm not going to dwell on that. I'm trying to look to make sure that there is no, you won't be shocked in the exam hall. So remember, if you look at the diagram and you know exactly what they are talking about. All right. Okay. This might come out. This should be the last one. Look at this diagram, guys. Does anybody have a problem with this diagram? Is there any question they will ask you in this diagram that you will not know? Yes, when you are talking about physeal, you're talking about the anterior and the hypothalamus. We are talking about the tract, hypophyseal tract. You're talking about the hypothalamus and the posterior. These kind of things are the things you need to jot down and remember. All right. So when you look at the diagram, you know what they're talking about. So look at this diagram, guys. We have A, B, C, D, E. What is the name of the hormone in E? Please, I need everybody to respond quickly. Come back from sleep. What's the hormone in E? Quickly. Because you need to know all these hormones. What is the hormone in E? Only one person? Come on now, guys. We need to go and finish up and go sleep. We have more than 20 people here. What's the hormone in E? Perfect. This is the energy I need. Perfect. Growth hormone. That is growth hormone. What's the hormone in D? Yeah, growth hormone. That's for E. What's the hormone in D? What's the hormone? Exactly, ACTH. They can ask you A, prolactin, you understand? B, thyroid thyroid stimulatory hormone, yes, TSH. So you need to know all these hormones. Like the C, you talk about FSH, LH, right? You need to know all of them. You really need to know all of them because they can ask you anyone, all right? Look at this one finally. Look at this. Look at this. Remember when I told you about the adrenal? I told you it has two parts, all right? Look at the question they can ask you. And we discussed this thing. If you don't remember it, please go to the video, watch that video. I have a video on reproduction and I have a review on reproduction. Endocrinology. I have a video on endocrinology and have a review on endocrinology. Yes, that question is ACTH. Look at this. ACTH hormone does not target which structure? Look at A, B, C, D, E. Which one does ACTH not target? Yes, ACTH is correct in that answer. Which one does ACTH not target? Which one is medulla? Yes, you are so correct. The answer is A. All right, that's medulla. Look at this one. Yes, the answer is A. It doesn't target the medulla. The answer is A. ACTH does not target the medulla. You understand? So look at this one. Which structure releases catecholamines? Which one releases catecholamines? Quickly, guys. That's okay. Which one produces catecholamines? The answer is also A. You understand? That's all this epinephrine, no epinephrine, even dopamine produced in some quantity in A. Look at this one. Which structure produces mineralocorticoids? Which one produces mineralocorticoids? Yes. Yes, mineralocorticoids is D. That's glomerulosa. All right. So final image is this. Please bear with me. This is the final image. Yes. D. You're correct. Catecholamines in that question is correct. So look at this question, guys. Look at this question. This image. Look at the image. Let me give you a question on it. Yes, D is correct. What type of hormone is found in B? Oh, I should make it smaller. What type of hormone is found in B? What type of hormone is found in B? Let me give you options. We have steroid hormones, we have peptide hormones, we have catecholamines, we have nucleotide, we have amino acids. Steroid hormones, peptide hormones, catecholamines, and nucleotides and amino acids. Remember, this is just a way, these hormones act, all right? Some jumps inside and their receptors is like this bee now enters inside the cell and the receptor is in the nucleus. You see, they're asking you which type of hormones exhibits this character in terms of activation, how they work. Then some cannot enter inside the cell, like this A cannot enter inside the cell. Instead, it laps on the receptor in the plasma membrane. Then the receptor now activates adenylyl cyclase, which activates ATP to CAMP. That's the second messenger, then which now triggers the entire kinase activities. All right. So the question is identify which hormone is B. Steroid, peptide, catecholamine, nucleotide, amino acid. Answer. You can't be guessing though, because we treated it. Yes, that means you were not in the review yesterday. Last week. Is it last week? Yes, I think Sunday. Yes. Yes, the answer is steroid hormone. The answer is steroid hormone. All right. Answer is steroid hormone. Very, very important that you know that. Now, they are asking you the final question. What molecule is found at C? What is that C? That C is the second messenger. The second messenger. What is C? Quickly, guys. That's the last question for today. What is C? Quickly. Yes, CAMP. All right. CAMP. Yeah, that's the second messenger. CAMP. Okay, guys. So that is it. All right. I need you guys to be very equipped, prepare very well. Come back to this video, watch it again. When you finish watching it in the morning, this night, just go and sleep. You don't need to study. You've tried. If you stayed with me from beginning to now, you've tried. Just go sleep. Right? When you wake up in the morning, take your time. Just bring out 2 hours. Put it in fast forward. Forward it, right? Or you can be jumping it as you go. But make sure you watch it from beginning to ending. You understand? Then at the ending, you just write ready. I want you at the ending, you just make a comment on this. You understand? If you have more time, you can look at the okay, you know what? I don't know if this my leg will allow me come to school tomorrow. Maybe I should move this exam to next week, Monday. I don't know if I'll be able to come tomorrow because of my leg. Okay, you know what? You know what, guys? Um, I want you to use tomorrow class to do your review as well. So we will not have a class tomorrow. For people that are in my class, please tell others. No, we will not have a class tomorrow, exam tomorrow or class tomorrow. You do the exam on Monday because we're already done. I'm already done with you this semester. So I still have free time on Monday. All right. I'm sorry about some people that it will cause a little discomfort because the exam is supposed to be 100 questions. So I shouldn't even be able to do it I can't even do it in 1 hour. All right. So, okay. So tell every other person, please, if you're in my class, go tell everybody. For people that are in my school and in my class, go tell everybody that the exam will be Monday. I'll send a message with respect to that. I won't be able to have class with you tomorrow because I really cannot drive with this leg right now. Like it's seriously disturbing me. So, but they are trying to sort it out for me. So Monday, you do your exam unfailingly. All right. Monday, I have 2 hours with you. That 2 hours, you're going to do your exam. 100 questions as usual. Okay. Thank you. I'm going to send out review. Are we doing another review? We've already done 2 reviews. Please. I have review, but it's with other students, all right? And you should come to those reviews because some of the topics I'm discussing with them is the same topic with yours for your final. So I have a review on Friday, I have a review on Sunday this week. So I'm going to send you a message with respect to that, but it's not your review. All right? Yeah. So, but your exam, for people that are in my class, the exam is next week, Monday. Thank you. And then let me remove this thing. So thank you so much. It's nice to have you guys. And I will see you to Monday, please. I'll see you Monday. Okay? Mm-hmm. No. No. I'll see you on Monday. All right. I'll see you on Monday. Um, Actually, the thing is, why I'm even postponing it is not even because of the how many questions. It's just because of my leg. That's just the thing. They asked me to rest it, so I'm trying to, see if I could rest it. So use tomorrow to still do more revisions, all right? You could always use the channel. I'll keep reminding you to come back to the channel and see the videos. I'll keep reminding you. Yeah. I'll keep reminding you to come back and see the videos. So thank you guys very much. Please tell every other person, put it in your group. This person is still, you are still discussing. The spirit tells me how many questions. I can do it 100, I can do it 150. Your final exam is 150, so you get used to it. Yes, your final exam is 150. So please, you need to, in short, I really want to cook you guys so that when you, because a lot of people, when I'm grading the final exams, all right, I see that people start failing those questions from around 70. And it's because they are fatigued already. You know, that they are not trained to withstand such questions. For people that are nursing, when you are writing your NCLEX, it's almost 150 questions. The medical students here, when you are writing USMLE, USMLE is like how many blocks of questions? 40, I think 40 questions, 8 blocks. Multiply it and you see how many, almost 300 something questions at a stretch. So they'll give you 30 minutes break. So get used to it, all right? Okay, thank you so much. Please spread the message. I'll send email right now. The spirit will tell me. Anyone you see, you answer, all right? But you know, Monday I have a lot of time with you, so any amount of question I give doesn't matter. Thank you so much. I have to leave you now. Take care. And always come back to the channel to watch those videos, all right? Come back to watch those videos. Get yourself more equipped, all right? Thank you, and have a wonderful night. Yeah, good night. Thank you. Yeah, bye-bye. Good night. Thank you so much. Thank you. Thank you. I will. I will. Yes. Thank you. You too. Have a nice night.